Test, 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 test. Good morning, everybody. If you can find your seats, we'll begin shortly. We'll give everybody the opportunity to travel to their chairs. Before we begin, I would like to acknowledge that the land that we are on today and we live and play and work is the unceded ancestral lands of the Mi'kmaq and the Boeckh, and that Labrador is the homelands of the Innu and the Inuit. Thank you so much, everybody, for joining us today. We are very excited about all the panel and keynote speakers that you'll be listening to as the day progresses. My name is Matt Piercy, and I'm the Director of Integrated Youth Services for Newfoundland and Labrador. I would like to acknowledge and welcome here today that we have our Atlantic Integrated Youth Services team in the audience today. We've been meeting this week talking about wonderful work and collaboration that we could do together. We also have members from our Newfoundland and Labrador Integrated Youth Services steering committees from across our wonderful province that are working diligently to see if we can do some services in rural Newfoundland and Labrador that is much needed. So welcome to you. We have government representatives here today, which I'll introduce momentarily, some of those. We have a wonderful contingent from Eastern Health. Thank you so much for being here today in our audience and supporting us. Community, as always, stand hand in hand with us. So thank you so much, all of the community partners that are in the room today. And of course, we are live streaming this event across Canada. So thank you, everybody that is joining us. When I first came down here, I was so impressed with the space that we're in. We have cameras all over the place, so don't steal anything because they'll catch you on live stream. It's awesome. You're going to be famous before the day is through. I would also like to recognize three people actually, that have traveled down across Canada to be with us today. Dr. Joe Henderson, who will be introduced formally as a keynote speaker in a moment. Ian Boeckh from the Graham Boeckh Foundation that supports the lovely and wonderful work that's happening with Integrated Youth Services across Canada. And Dr. Marnie Pierce as well. Thank you so much for joining us today. I do have some opening remarks. Whoever knows me, I'm not supposed to speak too much here because we have other speakers, but I never lose the opportunity to say a couple of words, so I will take this opportunity. No one can stop me. So, in St. John's, Newfoundland and Labrador, Choices for the Youth operates a community-based integrated youth services hub that we see up on Carter's Hill that many of you are familiar with. That hub provides a continuum of support through community-based care and wraparound supports, and I have the privilege to have my office up there and work each and every day. Through the combination of on-site basic needs, housing supports, family stability, employment and education supports, along with clinical supports that you'll hear a lot about as the day progresses, they have been able to successfully support young people in meeting their needs from across our province. These supports include physical and mental health needs, leading to better health outcomes while directly addressing social determinants of health, such as affordable housing, food security, labor market attachment, primary health care, and high school graduation. And those are all key concerns for not only our province, for people across our wonderful country. After 5 years of collaborating, and these are great stats, with over 65 community partners, 1,000 young people, and 300 plus service providers in 32 communities from across our province. We are working with 8 steering committees, and as I mentioned, representatives of those steering committees are here today and joining us on live stream from across our province to develop a provincial system of integrated youth service delivery, using data and generating knowledge and evidence to further transform services, enhance system capacity. We plan to introduce integrated youth services sites throughout the province so youth can receive timely care integrated services that they've been co-creating with us. We're actually bringing a group of youth to Bury Heights Camp on Seminary Line this weekend. That's part of our Youth Advisory Council to get their fingerprints all over the wonderful work that we're doing. We're extremely excited about that. Working with partnerships in community agencies and health authorities, each integrated youth site in the province will provide mental health and addiction services, as I said, primary health care, basic needs, education, and employment supports. The implementation of integrated youth services can help ensure that youth are adequately supported at a time when they need support, using approaches that are effective, comprehensive, and targeted to their needs and developmental stage. And that's what we're here today, is to explore more work on that. I always say it's about providing care for youth when and where they need it without barriers. That's what we want to do, and that's what we're here today to talk about. So thank you very much for joining us. I will look down and see, yes, wonderful. I had to get the thumbs up before I move forward. Today, we're very excited and honored that we're having greetings brought to us from two wonderful people, one representing the Government of Canada and one representing the Government of Newfoundland and Labrador. The Honourable Carolyn Bennett was first elected to the House of Commons in 1997 and was re-elected, just listen to this, 2000, 2004, 2006, 2008, 2011, 2015, 2019, and 2021, representing Toronto St. Paul's. She previously served as Minister of Crown of Indigenous Relations, Minister of Indigenous and Northern Affairs, and Minister of State and Public Health. Prior to her election in 1997, Minister Bennett was a family physician and a founding partner of Bedford Medical Associates in downtown Toronto. She was also an assistant professor in the Department of Family and Community Medicine in the University of Toronto. Her fight to save the Women's College Hospital of Toronto inspired her to enter into politics. Minister Bennett is an active representative of Toronto St. Paul's. She has organized over 75 town halls, quarterly meetings, information sessions, and special activities for her constituents since 2000. She and her office have assisted hundreds of constituents in their immigration, tax, pension, and employment insurance concerns. Minister Bennett speaks passionately about Canada and Canadians' participation in the democratic process. She advocates for health, the environment, women's involvement in politics, and persons with disabilities. She is also known for her strong support of Israel. In 1986, she received the Royal Life-Saving Society's Service Cross, a Commonwealth Honor Award recognizing more than 20 years of distinguished services. In 2002, she was a recipient of the Covenant Eve Award for contributing to the advancement of women in politics. In 2003, she received the first ever Champion of Mental Health Award for the Canadian Alliance on Mental Illness and Mental Health. She was also the first recipient of the National Award of Excellence for Outstanding Leadership and Dedication to Injury Prevention and Safety Promotion in Canada, and is the co-author of Kill or Cure, How Canadians Can Remake Their Healthcare System. Minister Bennett and her husband, Peter O'Brien, a Canadian film producer, have two sons, Jack and Ben. I was actually excited when I got the gold award for doing chin-ups in grade 6. This blows this out of the water. Greetings from our Honourable Minister, Carolyn Bennett.
Oh, thank you so much, and it is, I wish I was there with all of you. My only Newfoundland credentials this week is, of course, that my husband also produced the movie John and the Missus, and so last week Peter was in Vancouver and I was here in Ottawa with popcorn in our lap, missing Gordon Pinson a lot, and I wish at the Signal Hill.
introduction. I expected more.
Here, my medicine wheel, we remember as we give the management that there is something that we need to do, which is what you are doing every day, which is trying to help youth find the balance of mental, physical, emotional, spiritual, and be able to be proud of who they are, and that medical model that I was trained in medical school is not really where we need to go in terms of waiting for people to get sick and then patching them up. So as was said, that this low barrier approach where youth are very much part of what happens there and how the walls are painted and what they need to do to be able to make it easier for their friends to seek help with peer support and primary care, and that whole model of wraparound services that are oriented to that youth. I think in some ways it's the fight that we had for women's college almost 30 years ago, doctor to interdisciplinary, hospital to community, the patient at the center of their care, but also worrying about the social determinants of poverty and violence, the environment, shelter, equity, education. And as we move with the integrated youth services, we know that those wraparound services quite often end up helping with schooling or housing or finding a job, and that this is really how we can go forward in this way that is just literally catching fire across the country. And that one of the first joys I had as the new minister and the first minister for mental health and addictions was to visit in the Foundry in Vancouver, and then to be able to see these hub and huddle and kickstart and the models of care across the country. And so it is it is so exciting that you're all coming together to be able to share your wise and promising practices and be able to meet kids where they're at. The idea that it is 12 to 25, the idea that the social disruption and the difficulties of the pandemic have made everything so much more intense for young people who in terms of social isolation as well as the social disruption, everything changed. But I think that one of the silver linings may be that everyone is feeling a little bit more comfortable talking about their feelings, talking about their admitting that they're having some difficulties, but also maybe in terms of substance use. How do we take this moment where people are prepared to talk about mental health and move it into decreasing the stigma and being able to meet people where they're at, as they are able to be a little bit more comfortable talking amongst themselves. So it is I think so important as we now have all provinces and territories really moving in designing something that will work in their region, but also with these basic principles of youth-led and with the priorities being established of the youth and having the youth give the kind of feedback of what's working and not working. And so I think as we move forward to the real understanding across the country that and around the world that mental health is health, that we are really excited to be able to demonstrate that the IYS net and the sharing of practices and the real exciting evidence being produced by each of the regions, but also with the help of CIHR and Sam Weiss, that this is so exciting because the data sets that you're producing and that you're actually going to be able to persuade all of the decision makers that this is just an extraordinarily good investment and effective in meeting youth where they're at and helping turn around those lives one at a time. It is I think Um, Interesting that one of my friends who's a veteran said, "Why don't we have IYS for veterans or IVS?" That this is the kind of collaborative care, and it really is about team-based care and low barrier care, and it is, I think, a very exciting moment to just really take a moment and congratulate yourselves on really being part of this movement that's going to change lives. Today, we're happy to let you know that that $1,455,000 from this funding is available to fund the application directed at IYS Network in Newfoundland and Labrador for 5 years starting this year, and through this expansion will advance the Canada-wide research, collaboration, and knowledge mobilization while ensuring that all children and youth and their families in Newfoundland and across Canada receive the most appropriate supports they need. And so this is what we keep saying. We need the evidence to show the mantra of what is the most appropriate care in the most appropriate place by the most appropriate provider at the most appropriate time, including using virtual. We know in the agreements with the bilateral agreements in 2017 with the provinces and territories, of the 6 priorities they picked, IYS was number 1. And so as we move into the agreements from February 7th, with that extra $25 billion that will be part of the action plans and the bilateral agreements with all the provinces and territories, that we will be able to see in those 4 priorities, which is support to make sure everybody has attachment to a family health team and mental health supports, to the support for the people in the front line to prevent burnout and increase retention, to mental health and substance use, and the last, using the tools and the information sharing, data collection, all of that we see that IYS can be part of the action plan of all provinces and territories, and that is a very exciting time. So we just are so grateful for all the work you're doing. It makes my day every time I get to go and visit one of your sites and hear really from the young people who are your biggest boosters, even if I sort of think I'm the chief cheerleader for IYS across the country. But it is very, very exciting to have this approach that is trauma informed and culturally safe and youth led and evidence based. And so félicitations, congratulations, Willalan, Nakumik, merci, and just keep up the great work.
A number of, oh, she's gone. I was going to thank her, but I'll still thank her.
I'm still here.
Oh, sorry. Oh, we lost you off the screen. The screen went black. Now she ruined my surprise. A number of us in this room had the opportunity to travel to Vancouver in November to join colleagues from across the country in the work with the Federation of Integrated Youth Services, and we had the privilege and honor to be able to listen to the Honorable Carolyn Bennett speak about the work that's happening on a federal level, the work that's happening with Integrated Youth Services. I think often in my life, it's so easy to say negative things, you know. I think we all should say more positive stuff just in general. And I actually say I love you a lot to a lot of people, and I truly mean that from my heart. And I truly, truly love that work and love the Honorable Carolyn Bennett for the flag that she's waving in all the work that she's doing. I thank you from the bottom of my heart, from everybody that's in this room today. You're doing tremendous work, and we appreciate you and everything that you do. I d-
I'll take my leave now. You made my day. Okay. Bye.
See you. She's wonderful. And that was greetings from our Government of Canada, which we truly appreciate, and thank you so much. I would also like to welcome Gillian Sweeney, who is bringing remarks from our wonderful province of Newfoundland and Labrador. Gillian is the Assistant Deputy Minister of Population Health and Wellness. She is a part of our Guidance Council that's moving this work forward in Newfoundland and Labrador. Very, very intelligent person, lovely lady, big, huge heart. Gillian.
Good morning, everyone. Thanks so much for that introduction, Matt. It really is a pleasure to be here and attend the event, and I also get to bring greetings from Minister Osborne, who sends his regrets for the event. We all agree more needs to be done to address the mental health and social services needs of children and youth in our province. Young people face many challenges in today's world, including the impact of childhood trauma, poverty, stigma associated with mental health and addictions challenges, fears about climate change, and much more. Health Accord NL highlights the social determinants of health and the need to reduce poverty, as well as food and housing insecurity, while investing in our young people to help them thrive. We must all work together to ensure wraparound services and supports are available to our children and youth and their families throughout our province. Choices for Youth and others across the country, some of whom are here today, are doing innovative work on integrated youth services to help serve young people. I am a member of the Guidance Council created to oversee the work Choices for Youth is doing here, and I'm really happy to see the progress being made in Newfoundland and Labrador. At the same time, my department is also developing a new provincial child and youth health services model, which will consist of 4 provincial programs to address the needs of children, youth, and families. These programs and services are at various stages of implementation in our new provincial health authority, Newfoundland and Labrador Health Services, and include the mental health, behavioral, and social emotional support, which is known as MH BASES program. MH BASES will provide a flexible continuum of timely and appropriate mental health, behavioral, and social emotional supports to children, youth, and their families. In addition to existing mental health and behavioral intervention programming, new services are being implemented within this program to provide supports for parents and their children throughout our province. We are also in the process of rolling out family care teams. Family care teams represent a new vision of team-based care to transform our primary healthcare system. There are currently 8 teams established in various stages of implementation, with 11 more planned for this year. Family care teams offer seamless access to multiple healthcare professionals, including family physicians, nurse practitioners, nurses, social workers, and other allied health professionals who are focused on meeting both the health and social needs of individuals and families. We see the work of Choices for Youth on integrated youth services aligned with the MH BASES program as well as the family care team model, and look forward to further collaboration on how these models can serve our youth across home, school, and community. Thanks so much for inviting me today, and I hope you have a productive day of discussions and wish you all the best in your development of integrated youth services. Thanks so much.
Thank you, Gillian. We started work on this, and I say we, Choices for Youth and Newfoundland and Labrador, our partners started work on this many years ago. 2017, we did consultations. We could not be where we are today without the support of our provincial government. I thank you so much for walking hand in hand with us as we move this initiative forward. It's very exciting. I forgot to do housekeeping, so I'll do that right now. If anyone needs to use the washroom, please walk out this door here. There's a washroom as soon as you enter, leave on your right. Also, you could go down to the hallway and you could take a right, then take another right, and take another right, or you could just walk through this door and it's right there. So that's the other way to get to there. If, unfortunately, we have a fire alarm, please walk out this door. There's an exit to your left, and there's also the exit that you came in through. So you could do that as well. Today, we started with greetings. We are moving into a keynote address until 10:30, where we'll have a half an hour break. Then we can mingle and talk. There'll be refreshments as well. Then we'll reconvene at 11 for a panel discussion. We have 1, 2, 3, 4, 5, 6, 7, 8 panelists that will be sitting up here that will be taking questions, some of them from the audience, of course, and from live stream. And then when that's done, please stick around at 12:30-ish. We have a meal for everybody that I did not cook, but I'm sure it is absolutely delicious, so please stick around. I would love to introduce right now Kathy Newhook, who's going to lead the keynote address and introduce our keynote speakers. I will tell you that Kathy, we just met today. She's the manager of public policy and communications with the Harris Center. So that's absolutely wonderful. I'm also from Normanscope. I said I wasn't going to share this, but as soon as I heard Newhook, I was like, she's got to be from Normanscope because Newhooks are everywhere in Normanscope. We are possibly related. We're going to figure it out somewhere, but her partner in crime is from Normanscope, so we'll figure that out. Please.
Thanks, Matt. As soon as you said you weren't going to say that, I knew that you were, in fact, going to say that. So that's great. Yeah, all the Normanscope, all the Newhooks are from Normanscope, and yes, they're all related. So it's always an opportunity to meet a new cousin, for my children at least. So it is my pleasure to be here today on behalf of the Harris Center, and it's lovely to see such a nice big room, lots of folks and some familiar faces from my time at Choices for Youth many years ago. And it's always a pleasure to see how much the organization has grown since then and continues to be a leader. So I won't take too long up here. It's my job to introduce to you the keynote speakers for today, and what a pleasure that is. So we have Dr. Joe Henderson, and they're the director of the Margaret and Wallace McCann Center for Child, Youth, and Family Mental Health at the Center for Addiction and Mental Health, the Center for Addiction and Mental Health, and the executive director for Youth Wellness Hub, Ontario. They're also a senior scientist at CAMH, and the professor in the Department of Psychiatry at the University of Toronto. Their work aims to improve access to high-quality integrated services for youth and with substance use and with mental health concerns and their families. And of course, we also have Sheldon Pollett. Sheldon has been the executive director of Choices for Youth since 2001. During his tenure, the organization has become a national leader and partner in identifying best practices in the design and delivery of services to youth and young families. These supportive services span the continuum of prevention, early intervention, housing, and social enterprise. Sheldon is the former co-chair of the National Learning Community on Youth Homelessness and is the former founding board member of Away Home Canada, a national coalition to end youth homelessness. He's also a member of the Canadian Observatory on Homelessness, and Sheldon is the current chair of the Minister's Advisory Committee on Mental Health and Addictions. So I know we're very excited to hear from both of you. So I'll ask Sheldon to kick things off for us.
I just love it when I go places and I can say, oh, this person used to work for Choices for Youth and this person used to work for Choices for Youth. They're wonderful people. Thank you all for being here again. Thank you, Matt. What a wonderful job. I hate emceeing things. He's wonderful at it. I thought a long time about what to say today. And many of you have heard me say this before, but for those in the room who have not heard me say this before, we all have youth and children in our own lives that we care about. And if I get emotional, half of the room is not surprised. what would you want the response to be? If a child or youth in your life needed a response from the system. And when I say system, I include the community. I am pretty sure what we have right now is nowhere close to that. So how to design a system that meets the needs of children and youth. And I'm very pleased, Jillian, the work that's happening in the provincial government is amazing. It is a part of the solution. What you're going to hear from Joe Henderson, and I didn't have slides, I have a notebook, is a clear vision of what any of us would want for the children in our own lives. The young people we're talking about deserve every opportunity to grow and thrive and achieve whatever it is they want to achieve as any other child or youth in this province. That is what is the most important thing about anything you take away from today and the conversations that are happening across this country over and over and over again. One of the things that we're clear on, so I sit on the Minister's Council on Mental Health and Addictions. So for those who don't know, huge work, transformative work, came out of an all-party committee a few years ago on mental health and addictions in this province. And it began to really grapple with how to transform systems of care around mental health and addictions in this province. And then we started talking about youth and children and young families. I'm very pleased that that is a big chunk of a lot of the recommendations that were in that report. One of the pieces that really hit me over time, and I've said this publicly before as well, with all due respect for everyone working in every part of that system, do we actually even have a system? Like if you look at the definition of the word system and you look at what we have, I don't think this is about redesigning a system. This is about really creating a system that we've really never had in this province, in this country, to focus on in a prevention, early intervention way. We all know that works. This is not rocket science, this is not new. How to create, in today's world, which is dramatically different, been at Choices for Youth doing this work for 22 years, I guarantee you what we're dealing with today, not just in terms of the number of youth, which has exploded, but also the complexity of what they're coming with over that time is drastically different. So not only do we need to design a system, we need to design a system for a whole new world. Even after COVID and what we've seen coming out of COVID, higher and higher numbers of youth showing up at our doorstep homeless, higher and higher number of youth showing up with significant drug and alcohol issues, higher and higher number of young people on every category that you don't want to see in our province. One of the things I'm also struck by, we're all well aware we have a declining youth population in our province. A number I heard a couple years ago, I think 10 years ago, we had like 120,000 school-aged children in our province. The recent number I heard a couple years ago was, I don't know, somewhere around 66,000 school-aged children in our province. That's a scary proposition for our province. We're all well aware of it. What I can also tell you is more and more of those young people are ending up in harm's way. So it's even worse for our province. Now, that sounds pretty catastrophic. I'm not a dramatic person when it comes to this. There are real solutions that are at our fingertips. Our province has been a leader, can be a leader, should be a leader in all of this work. Often with my national partners, they said, but your province is, just big enough, just small enough that actually you can be really agile. And we actually can be. We have to make the choice to be truly innovative and move in this direction. So when you look at the work from the provincial government, look at towards recovery work, you look at, the health accord work, that's, transforming things, as we speak. We look at the wellness plan. I see Renee back there, so, feel free to write stuff down. The educational outcomes work. We're now into schools doing innovative work to prevent young people from dropping out of school, but guess what? All the factors that you would address to increase school engagement are the exact same factors you would tackle to prevent future youth homelessness. It is that simple. And there are other plans and pieces of work that this aligns so clearly with, and how to work with those family care teams. I think Joe in our meeting yesterday talked about. We're creating all these family care teams, amazing, important transformation. How well these integrated youth services teams and sites can work with a remodeled formal healthcare system. Incredibly important. Dr. Gagné, I think, is either here or going to be here later on the panel talking about a downtown healthcare collaborative, primary care initiative that's embedded directly in a integrated youth services site, and how incredibly impactful that is. So, there's my opening remarks going on in terms of our pathway to integrated youth service delivery. Sounds fancy. Didn't start that way. In 2004, we had the bright idea, we're going to create a downtown youth services center. Sounds wonderful. We're going to put a pile of people in it, put up a flag, and say to young people, like, we may not be able to address all your needs, but it's a good place to start. What we failed to realize was how many young people in harm's way would take us up on that offer. So what happened with no plan other than one part-time coordinator who would greet young people at the door, we were overwhelmed. 100, 120 young people a day bringing their street lives to our doorstep. It's not their fault. We didn't have a plan. So I remember, and Jeannie, I'm going to pick on you. Jeannie runs our Mom and Wellness program. Amazing work. Some of the best, proudest work we are doing at Choice of Youth with young families. And I remember being there one day, Jeannie. I don't know if you've heard me tell this story, but I've said it a lot. And I looked across the room, and as amazing as Jeannie and her team are, I said, oh my God, Jeannie looks scared. Because we were descended on, and it was violent, it was all of these things, it was the expression of all the challenges of unmet needs that these young people were bringing to our doorsteps. And we stopped. We have to make a plan. We could have put up plexiglass. We could have said, we're not doing this anymore. No, we said, we're going to make a plan. So you go to our youth services center today, all you find is a doorbell and a locked door. Nothing else has changed. It's wide open. You walk in. You own and deserve to be in that space just as much as I do. So the pathway was around creating a plan around how to meet the needs of young people. Young people wanted to feel safe. Our staff needed to feel safe. Everyone needed to feel safe and respected, and over time building towards something. So here's the connect to IYS. Myself and Joe actually met in, I don't know, whatever it was, 2013, around national work that was starting to figure this stuff out. So I've often thought, this stuff is organic. There's a reason why this has evolved independently to some degree. Across this country, we all arrived at the same place. Why is that? Is that coincidence? I don't think there's a national study on it just yet, but it's not coincidental because it works. Right? One of the things in our meetings with government yesterday, and we've said this before, I get to combine resources, but I also get to combine mandates. So young people don't have to go all over the place to get their needs met. When we first created a clinic in the youth services site, the clinic was downstairs. A set of stairs was enough to prevent young people from engaging with physicians 15 years ago. How do we brought the clinic upstairs, began to integrate more, so they became part of one team. Imagine that. And got to the point then where young people could identify with our outreach staff the same way they would identify with the addiction counselor, the same way they would identify with the housing support worker, and getting to that point where everyone just was one team. The model we always had is young people don't care who pays my salary as long as they get what they need. That is the spirit of what became that organic move towards integrated youth service delivery. So the work since then has been around, we know from former point in time counts in this province, easily, and I don't think the number's gone down, 50% of the young people we're seeing on a daily basis are coming from other parts of the province. Let's be clear, we're not going to change the move of youth into urban centers anytime soon, but these young people are not coming because it's a normal stage of life that they want to go and explore the big city. They're coming because they need help. And we know from talking to young people, They don't necessarily want to be here. As challenging as their home communities can be, and there's some real serious issues that these young people are trying to get, like it's getting away from and going towards support. We know, but still, young people are better off supported culturally appropriate ways, closer to their home communities, to try and maintain some connection with those that they care about or care about them. So how do we transform and adapt what we've learned across the country, what we've learned at Choices for Youth since 2004, the hard way, and support these communities, as Matt said, thousands of young people, hundreds of stakeholders, ready, willing, wanting to be a part of something like this in these communities. It has to be regional. We know we can't necessarily put a youth service site in every kind of small community in the province, so there has to be some function around how those regional hubs reach out to smaller and smaller communities. I think there's someone here in our discussions yesterday talked about some sites are figuring out how to do kind of almost like mobile clinics from regional centers, so all kinds of good, innovative ideas that will come out of that as well. So, at Choices for Youth, we also get into other areas of life. So the other thing I tend to say is, how many of us would be here if we didn't have a safe place to go tonight? How many of us would be here if we didn't know where our next meal was coming from? How many of us would be here if we were experiencing ongoing, trauma or violence in our lives? Probably, I'd be talking to an empty room. Young people going through all these challenges deserve all the opportunities that we get to have, because we have the building blocks of a healthy, happy life. A safe place to live, people around us who support and love us, access to education, access to a decent employment, standard of living, so you're not living in poverty. All of those pieces are the next set of things that we begin to deal with. At Choices for Youth, we're very holistic, so we want to track mental health outcomes. We also want to track decreased child apprehension. We know investing more and more into a child apprehension is amazing. Like, I have so many friends working in that system. It's not about the people, it's about the system. We spend maximum dollars for the poorest outcomes in many of our systems. We know this, right? This is not news. So how to support vulnerable families in a completely different way. You can track decreased hospital visits, decreased emergency room visits, increased housing stability, increased educational success, more time with family, with their children in their care. That's just on the family side of it. You look at young people who are struggling with housing, so it's stability, stability, stability. And again, meeting basic needs is an incredibly important first step in all this work. That's the beauty of a community-based integrated youth services site connected to better functioning formal systems. So, I promised 10 minutes, but I'm pretty sure I'm well over that, Kathy. You're just laughing. So the evolution continues. You're going to hear today, think of that question when you listen to what Joe has to say. What would the response be, or what would you want the response to be, I should say, for children that are in your world? If the worst thing in the possible world happened and they needed help from someone, I can guarantee what Joe's about to tell you is so much closer to what that would be than what we have right now. And it is very possible. Thank you.
Well, I hope I live up to expectations here. Thanks so much, Sheldon, for setting this stage. It's really fantastic to be here. I'm going to tell you about, I feel like I'm nope, I'm good. And you're going to tell me how to start the slides. Excellent. So I'm really excited to be here. This is one of my favorite places in Canada. And, everyone keeps saying to me, like, we're sorry about the weather, like we had hoped spring would be further along, but from my perspective, it's been just perfect. I'm going to tell you about Youth Wellness Hubs Ontario. The mic feels weird to me, but whatever, someone else can think about that. I'm going to tell you a lot of stuff as we go along. I have no notes. I'm happy to share my slides. I want to give you a sense of the work that's happened, but this is our collective work. I get to talk about it, but it's really all of our work together. The brand you see here is the brand that was created by youth for youth, and things like our tagline, Wellness Your Way, come directly from our youth who we partner with. As I said, I get to talk to you about this work, but it's really a privilege for me to do so. I'm representing and amplifying the voices of over 1,000 youth and families, hundreds of service providers, and lots of other folks as well. And I really do consider it the most amazing thing I've ever had the opportunity to do. So why integrated youth services? Well, I am going to do a little bit of a history thing because part of this did originate starting with this project. Oh, here I go. I always get to change the slides without touching anything. It's really interesting. We did this most fantastic project, all of us. And you'll see Sheldon was referring to it. This was from 2009 to 2013. And we worked with communities across the country to think about how do we start to build better systems of care for young people. What were the needs? What did youth and families want to see from a service system? And one of the most important experiences I had was right here at Choices for Youth. That was my first introduction to what a different model of service delivery could look like, a model of service delivery that was co-designed with young people. And when you Sheldon, talk about a model of service delivery that doesn't have plexiglass, I mean, aside from the pandemic, which of course messed everything up around that, like the idea that you walk into a space where you can access service and there are no barriers, no physical barriers, no other kinds of barriers, that originated here. And this is a quote from a young person I had the pleasure of meeting at that time, who really, said in words, which we all know intuitively, but our systems are not built in the way that this young person described. And in fact, I would agree completely with Sheldon that we don't have a system. We're starting to have a system in Ontario, but we are so far from having a comprehensive system. We have one vision, and that's that every young person has the opportunity to achieve their optimal outcome. Whether that's in Ontario, or that's here in Newfoundland and Labrador, or that's across Canada, it has to be our vision. And so how are we going to get there? How are we going to do right by this young person? Well, through that project, we went across the country, we did all kinds of wild things, and we worked with all kinds of communities, learned from all kinds of communities. And at the end of it all, we had all this information we had gathered about youth needs, and we asked youth and family members and service providers, what should we do to address these gaps? And they started to describe a model of service delivery that seemed impossible at the time. And actually, sometimes people still say to us, this isn't possible. Like, what you're suggesting we do, that we center young people, that we get rid of fragmentation, that we provide immediate access even if you are not, you don't have those high acute needs, but you actually just need support. It actually is possible. If we don't imagine that something we think that others are telling us is impossible, if we don't imagine that we can do it, we won't be able to do it. This initiative has really been about sort of really taking on the challenge of being unsatisfied with the status quo, really taking on the idea that we can design systems of care, a system of care that keeps youth and families at the center, that delivers culturally appropriate, safe care, that pays attention to groups of young people and individual young people who have never been treated adequately before. We can actually do it. Here are a couple of quotes. I always have so much energy, I mess all of the electrical systems up, but that's okay. So what makes me me? So I'm going to tell you a little bit about Youth Wellness Hubs Ontario. So coming right down to like the Ontario sort of work that we're doing, but I want you to sort of, and I'll come back to sort of a pan-Canadian picture after, but this is just an exemplar. This is not the answer to what's happening, like what you're doing here. This is an example of the kinds of things we've been thinking about, the kinds of things we've been doing, and also that we've learned from youth and families and people like Sheldon here in this province. As I said, we did lots of work across the country. We heard about the kinds of things that are important to young people, and then we had to take it back to Ontario. So as Sheldon alluded to, and Matt as well, and fantastic emceeing Matt. So, and Minister Bennett as well. A new system of care has to center youth and family voices. And so at the beginning of Youth Wellness Hubs Ontario, this is just one example from a graphic artist, we spent our time in community. Ontario is a very geographically large province. Most of the population is in the south. And really important populations are spread across the rest of the province. So most of the province is rural remote, though most of the population is in the south. We really knew that we had to build a model that would meet the needs of youth living in Northern Ontario, rural remote communities, as well as youth living in urban centers. And so we spent a lot of time in community learning from youth. And so these are the kinds of things they talked about. Most importantly, they really emphasized the idea of holistic care, which we've already heard about today. The idea that you can't separate mental health from physical health, from substance use-related concerns, from poverty, food security, housing, education, employment, all of these kinds of things. Doing this kind of work, you have to find a way to ensure that you are thinking, from my perspective anyways, not about developing a new service stream, but in fact, how are we transforming what we already have? And so with this model of service delivery, we really worked with existing community organizations and community services to bring people together, to have a common vision about improved youth outcomes and work together differently. And so our priority areas were to focus on youth experience and outcomes. Youth, and if I go back to this slide, I don't know, there's probably a pointer here. You'll see, oh, it doesn't matter anyways. But what we heard from youth, like sometimes this surprises people, youth actually asked for care that works. Pretty cool, huh? You want to enter a system of care and get a service that works. How many of you can tell me about how effective mental health services are in Canada? Anyone? Anyone? Yeah, no, we know very, very little. And so we owe it to people, we owe it to young people, we owe it to all of us to really design a system that can speak to whether services work, can speak to outcomes. Of course, we want to reduce fragmentation. We don't want young people to have to go everywhere. We want them to walk in one door and say, damn it, things suck. And we say, that's all right, we got your back. You came to the right place. We will figure it out. You don't need to figure it out. We will figure it out. You just walk through the door. And so really that focus on integration, quality, inequities. We're not just about sort of an equity plan that says, let's have an equity officer who tells us how important equity is. We're about ensuring the outcomes we deliver are equitable across all youth. And in Ontario, and I don't know if this is true here or not, but in Ontario, we're heavily organized around a pediatric and adult system that stops at age 18, a pediatric system that has a broader embrace than the adult system, which is like really like squished and focused on a very narrow set of services. There was really nothing for transition age youth in Ontario at the time, and so that was one of the really important things we wanted to address. So we really imagine ourselves, and I didn't create this slide, but I think it's a fantastic slide. We really imagine ourselves taking this kind of mess of services and organizing them into something much more cohesive that integrates primary care, mental health, substance use, and all kinds of skills and well-being related activities. In Ontario, so I've kind of alluded to this. I've said it's multi-organization, multi-discipline. In Ontario, people come together, they form networks, basically. Each community has a network of organizations that includes adolescent and adult organizations across sectors to decide together as an all-of-community approach, how are we going to support our youth to deliver, how are we going to support our youth to help them achieve their best outcomes as they define it. And so we have 22 networks that are funded by the provincial government, and those networks operate 31 locations. We've got a new one that just opened across lots of different contexts in the province. Some of these hubs are led by Francophone organizations. Ontario is a bilingual province. And some of these hubs are led by First Nations organizations in Ontario. And we aim to address the needs of rural youth, urban youth, and lots of cultural diversity. Our model of service delivery has mental health and substance use, primary care. This is the government slide about our initiative, but as well as education, employment, community, and recreational services. We have lots of evidence, and I'll show you a little bit of our evidence to show that it's those broader array of services, the skills and well-being services that really draw young people in, allow us to prove our credibility. We are systems and services that have often caused harm, or we're perceived to be an extension of services that have caused harm. And deservingly, we don't have youth's trust. We need to earn it. And so having a broad array of skills and well-being activities, everything from cooking classes to access to laundry, food banks, clothing banks, to time on the land, Dungeons and Dragons nights, 2S LGBTQ social night, like we do the whole gamut. Those things draw young people in and give us opportunities to build relationships and then help meet their mental health and substance use needs. Our youth, we serve youth 12 to 25. Our youth wellness team includes mental health and addictions clinician, nurse practitioner, peer support worker, never funded by government before in Ontario for mental health, for our youth mental health. Big win there. Care navigation, and the person who's responsible for making sure that we actually use measurement-based care, that we actually use strategic and systematic approaches to delivering good care, that we understand quality. And all of these people have to like young people. It's a requirement of working at a hub. This is a new thing because this isn't always the way it is, right? You actually have to like young people. We operate by core components as opposed to, like, sometimes you hear about a collection of services. We're kind of very values forward. We're very committed to a way of operating as the most important thing that differentiates us from the rest of the system. Youth, family, and community engagement. Governments and everyone within a community making decisions jointly in the best interests of young people, so that integrated governance piece, creating high levels of access, no barrier as much as possible. But of course, we can't always know what all the barriers are. That's why we have to partner with youth to understand the barriers. We offer identity-affirming services, culturally appropriate services, lots of diversity in the kinds of services and staff who we hire. It's really critically important that the staff reflect the community and the youth who live in the community. Integrated service delivery. Youth deserve seamless experiences, and so we focus very much on creating that. And measurement-based care. So what do I mean by measurement-based care? It's really just the idea that over time, we keep checking how we're doing. Are we actually supporting the youth to achieve the goals they hope to achieve, or have we slipped off in some other direction? And by using measures, and there are lots of challenges with some of the measures that are commonly used, and we can sort of figure that piece out. The key thing to do is to consistently measure over time to make sure we're achieving that vision of quality that we aim to achieve. Like I said, equity, our focus, this slide here is really just to exemplify that equity is woven through everything, and it's a focus on action, not on statements and all of that kind of stuff. So I could have 10, I could have 20 circles here, but it just gives you a sense of how we embed equity in everything we do. The kinds of services we offer, sometimes integrated youth services, especially at the beginning, was really conceived of, like people perceived it to be focused on young people experiencing mild to moderate difficulties, but in fact, that's not at all what we're doing. We offer treatment, clinical services, pretty much the full range of need, and we do that across multiple different areas. This gives you a bit of a sense of what some of our service options are, some of the pathways, and what some of the services at different levels of intensity are in terms of our clinical teams. The other thing that differentiates us, though, is that we are a network of networks. So we already have our community networks, but in order to build a system, we need to have all of those community networks network together. Otherwise, we're really just replicating the status quo. We just create more services sprinkled across a province that are disconnected. We miss an opportunity. I like to I've used this often. If you've heard it already, I apologize. But we could take a young person, and I say this with young people, like I'll say to a group of young people, so if I took you up in a helicopter and I dropped you out of the helicopter with a parachute, of course, anywhere in the province of Ontario, and you wanted to get a coffee, where would you go? You're going to tell me Tim Hortons, maybe Starbucks, maybe Robin's Donuts, that's more popular in the north. They can tell me something. And when kids are 17, 18, we typically do this in Ontario. They kind of go off in different places. I drop you out of that helicopter. Actually, you're feeling really overwhelmed. You don't know where to go. You don't know what to do. Where do you go? In Ontario, there was no way to find services. No common services for young people across the province. The big blue H for the emergency room, that's where young people go. Any of you who have gone to the emergency room with a mental health problem will know that that's really not the optimal spot to go if you're feeling really anxious, or if you're having a whole wide variety of other difficulties. What we really need is a common brand across the province. We need all the services linked together. We need a way of building a system. And so that's what we're doing. We have a provincial office, which is really the network of networks. We're the glue that holds everything together. Within that backbone, it's really critical in order for us to achieve this vision to have multiple different pieces of support for all of the communities to benefit from. And so we have things like project management. Importantly, we have people who are expert in measurement and evaluation. We offer coaching to communities across the province in how to do youth engagement, how to make decisions that reduce inequity. We support youth and family engagement at the local level, but also at the provincial level. We have a provincial Indigenous Youth and Family Advisory Circle. We have provincial youth and family engagement. We have common branding and communications to build that system vision. And we support implementation using implementation science, which is one particular approach to support implementation, but really thinking from a change management perspective. There's a lot of change. We're not going to do something different than the status quo without actually doing something different. And the doing something different is hard for humans generally. We operate as a learning health system, really fancy language to say, well, we really try to understand how we're doing. We do that through data. We look at the data. I don't know how many of you have been involved in those initiatives where you fill out a spreadsheet and you send it off into whatever. That's the data, and no one ever looks at it again. And you're kind of like, I wonder what happened to that. Well, this is really about you're gathering information, you use it for the young person in front of you to support them in achieving their goals, but we also bring it together, we look at it to understand what are the needs of young people, say within a hub, what are the needs of young people across the province, and how can we respond? What do we need to do differently to achieve better outcomes? Then we do that thing, and then we reevaluate. So that's really all this means. But if you use fancy language, you get more money, so we use fancy language often. This is like the most important thing I learned in graduate school, use fancy language. So I've gotten, well, it depends on the day whether I'm good at it or not. Measurement-based care, we have lots of reasons to use measurement-based care, one of which is, as I said before, young people are asking for quality services, and if we don't measure, we can't tell them the quality. It's one thing. The other thing is, it turns out it actually results in better outcomes if you use measurement-based care, especially for the most vulnerable young people who you may miss that they're not actually benefiting from the services. As humans, we have a bit of a blind spot to when things aren't going as we expect. It's really through measurement-based care that we have that opportunity to identify young people who are not benefiting and then change course. Within WIHU, measurement-based care and data is critical. So we actually, and people said this was impossible, 100% not possible. We implemented a common data platform across community-based organizations, more than 100 across the province. They all use the same platform and they all use the same measures. And that means I can tell you a little bit about the young people we serve today, and we can think about quality, we can think about outcomes. So what happens when communities work together? We have some rules about how and when I present data publicly. So these are data based just on 12 sites who have kind of met the criteria for delivering high quality data. And this is from the beginning of the pandemic, April 1st, 2020 through to December 31st, 2022. We have 81,000 visits, about 81,000 visits. About 26,000 of those visits are clinical visits, youth wellness team visits, so mental health, substance use, primary care. Remember I said youth are coming through the door for those other services, the skills and well-being, often anonymous services. 55,000 of our visits are through those doors. And with those clinical services, we've served about 6,100 youth. When we set out to do this work, we really wanted to reach youth who were not having the opportunity to engage with services that could help them achieve their goals. We feel like we've been able to do that quite well. So about 39% of youth, when they come through the door, indicate that if the hub hadn't been there, they would have gone nowhere, or they don't know where they would have gone. We wanted to meet the needs of transition-age youth. About 52% of youth who use hubs in Ontario are transition-age youth. If you include the 17-year-olds, you're up over 60%. We really are meeting the needs of young people in that age range. Young people coming through the door are distressed. 90% have moderate to severe levels of distress. It really speaks to the need to provide that timely access. Young people need to be able to walk in and get access. And unfortunately, about half of young people have thought about hurting themselves or killing themselves in the 2 weeks before they come to the hub. It's good, they're reaching out. But how well equipped is our system to actually support young people and help them move along? It's the work we have ahead. Substance use is also significant amongst youth that we work with. And this particular measure is not just any substance use, so this is a measure, though it has its own challenges, the measure does. It's a measure of substance use related difficulties. So it's quite it's a threshold that's meaningful. About half of youth are indicating moderate to high levels of problematic substance use or substance use related problems. So what do I mean that we operate as a learning health system? Don't worry, I'm getting close to finishing soon. I know, I'm like, okay, I gotta pick up the pace here. Okay, so I don't know how many of you watched the news or read a news feed during the pandemic. Any of you? Any of you? Yeah, okay. You will probably have noticed that there was a lot of concern that emerged over the course of the pandemic about how young people were doing in terms of engaging virtually in Ontario. Like we had, I think it was like in the world, we had the most number of days outside of in-person education, amongst the highest in the world. Like our schools were shut down forever. And so people became, and we started to see evidence that young people were struggling with how they looked, how they felt, how they perceived themselves, and eating-related concerns. And when people started to sort of talk about this, we thought, well, we have data. Let's look at our data and see what's going on. When we looked at our data, I don't know, I can't get this to work, but here, this is 1 year into the pandemic. So that's when young people had sort of gotten into being at home and no longer engaging with some healthy related activities they may have done in the past. When we looked at that data, we saw almost half of young people indicated significant eating related concerns. And we're like, oh my God, what are our service providers doing about this across the province in all these hubs? 16,000 visits were recorded that had something to do with eating or nutrition. And we thought, what are the service providers doing during those visits? Because eating disorders capacity was not very high in the province, especially early intervention around eating disorders. What are they actually doing? Because we're a learning health system, because we're a network of networks, push a button, survey goes out to all of our service providers. How well equipped do you feel to deal with this? What strategies are you using? Was not so happy about what I heard back. People actually didn't feel like they knew what to do. So we were able to immediately go to our government partners and say, we have a problem. We need support. We need capacity building. Engage with eating disorders related experts and built something immediately. We could pivot, we could respond, we could strengthen our system, we could alleviate this emerging difficulty and help get young people back on track. And now we're even moving to a bigger vision where we'll systematically implement an early intervention model, evidence-based early intervention model for eating-related concerns. This is a very small sample size. I could actually show you data with very large numbers, but as I said, we go through a process and we share the data with youth and family members, communities, before we share it publicly. So these are old data, but it gives you a sense of the kind of outcomes we can monitor and share. And so the majority of young people report reduced psychological distress. And in terms of service experience, which is typically what's been a barrier for young people engaging with the system, the service experience ratings are very, very high. This isn't happening just in Ontario, though. It's happening across the country. And in addition to that, some of you may be familiar, some of you will be familiar with Access Open Minds. Access Open Minds was an initiative that was a research-based initiative to transform adolescent mental health or youth mental health systems. They continue to exist through their Indigenous Integrated Youth Services Research Network. And then these are all of the other initiatives across the country. And we're working together, just before I show my thank you slide, I thought I had one more slide, but apparently I do not. So we're working together, and the thing I think that Sheldon said that's just been remarkable about this, like I'm close to 1 million years old. I started working in mental health last century, and there has never, 1994, so it is a long time ago, there's never been a time before in my career where we've had donors, government funders, federal, provincial, municipal, youth, families, service providers, all coming together around one common vision. Really that vision that every young person deserves the opportunity to achieve their best outcome. And as Sheldon was saying, it's interesting because each of these initiatives has grassroots origins in each of their provinces. But when we look at them all together, which we've done, where there's so many similarities. And so now not only are we working as a network of networks within our provinces and territories, we're starting to work as a network of networks of networks across the country, really allowing us to learn from one another. And all of you who are here from other Atlantic provinces, working together, thinking together, that's what's going to drive all of this forward. So it's a really exciting time. Now I'll go to my thank you slide and say thanks so much for hearing me out today. I hope something's been useful, and I'll look forward to a continued conversation.
Thank you so much. That was excellent and so wonderful to hear about all the good stuff that's happening. We're going to continue this conversation, lucky for us. So if I can ask Sheldon and Joe to join me on the couch over here, we'll continue with. I've got a few questions to get us started, and then we'll open up the floor to Q&A with the audience. So you can prep your questions. If you're watching online, you can type them in the chat or the Q&A, and we'll read them out in the room. So you can start writing them now if you want, and we'll get to them when the time comes. But if you're in the room, you can make a note or keep your hand. You'll be able to raise your hand to be able to ask a question in person. I think the mics are really important for the people online too. So I live in this building, so that's what I feel like. So we always know the ins and outs of what to do in these sorts of situations. So I think I know this room, I'm sure, has lots of questions, but I'll start with a few. So there's been a big shift globally and nationally and internationally, or provincially, sorry, to a more holistic and integrated, like health in all policies kind of perspective. So how does the integrated youth services align with the current provincial and federal priorities and policy initiatives? I'm going to start with Joe, even though I know you probably need a break.
No, that's totally fine. Yeah, so it does feel like there are lots of things that have come together, and there's lots of complementarity in the systems right now. In Ontario, over the last 5 years, there's been an initiative to build, they kind of dismantled our old way of doing things across health and started to build health teams. So these are regional kind of health teams that involve primary care and all different services within a community, but across all of health. And then in each of those regions, they identified their priority areas. In all of the regions in Ontario, mental health was a priority, not surprisingly, and very pleased to see that. I think we were starting around the same time, and so we have a really interesting opportunity to both develop kind of in lockstep with those developments, but also be a little bit ahead because we're more agile, we're smaller, we're more focused. Like when you're trying to build a health team to address all of health across all ages, it's a big endeavor. And so government will say in Ontario, they've said publicly, like they see us, Integrated Youth Services, or Youth Wellness Subs Ontario, as really a small version of that, an opportunity to learn about how to do health team work well, and nice sort of complementary activities that are happening in a community. Mostly, the leaders of IYS are also leaders in Ontario health teams, so you have that really smooth transition of information across the two. And then I think at the federal level, Minister Bennett even said it here today. Minister Bennett and others talk about integrated youth services becoming a model for other aspects of healthcare. So Minister Bennett referred to veterans here, but I've also heard her say the same kind of thing in with reference to other parts of the healthcare system, like how can we take what we're learning here through integrated youth services and apply it to other health conditions or other parts of the healthcare system. So I think we're really it's like really exciting because we do have the opportunity to sort of test out different things and bring that back to that broader picture, whether it's in Ontario health teams or it's federally.
So how does that play out here in Newfoundland and Labrador?
I think from my perspective, during my talk, I mentioned a number of policy initiatives that have been ongoing in our province for quite some time. And if you really understood, or at least from my perspective, like there's a common theme underneath all of those, right? How to, more effectively use the resources we have for better outcomes for vulnerable populations, right? They're just variations on a theme, but they're all meant to do the same thing. I'm going to segue a little bit. Hopefully this will make sense. So choice is few because of the diversity of what we've gotten ourselves into over time to meet the needs of young people. So this conversation is playing out in the social enterprise field, right? How does social enterprise, thanks Jen, I have a habit of holding my microphone down here. How does social enterprise prove to be a more effective way to train, employ vulnerable young people, in our case, to achieve the outcomes they want from an employment education perspective? Well, that's in social policy innovation, social finance, social procurement, all those tools around how to rewire public policy, in this case, around a very different world. Let's face it, like many of our social policy kind of foundations are, built 30 years ago, 40 years ago. How to shift all of those to a world that looks very different, A, and B, we know a lot more now about what truly works for vulnerable populations than we knew 30 years ago. One of the really exciting pilots, for example, that we're working with at Choice of Youth, it is connected to IYS. It is around income support pilot initiatives. So through our social enterprises, playing with support of the provincial government, playing with the income support rules that create barriers for people coming off the income support system to go to work in much healthier, sustainable ways. So that's a very innovative pilot, and it has wraparound support. So from my perspective, we talk a lot in the language of wraparound support. You can call it holistic supports. You can call it a focus on the determinants of health. It's just different language to say the same thing, which is how to meet the needs of vulnerable folks in a way that means more to them, right? Young people saying, I just want a response that works for me. One of the stories I've often told, I don't know if it's the same now, but Towards Recovery was tackling some of this stuff. Years ago, the stat I heard, for example, was in the mental health system, there was about the addiction system, there's about a 33% no-show rate for addiction services appointment. So you stop and think about that, right? Well, that's cost of doing business. 33% of the time, people just don't show up. The right way to think about it is who's most likely not to show up to that traditional Friday afternoon 2:30 addictions appointment. 33% of the time, we're offering people what doesn't work for them. And then when I look at IYS, what works for young people is to walk into a building and be greeted in a way that's respectful, not judgmental, trauma-informed, harm reduction, all recovery focused, all those pieces, and they get what they need, or at least begin to get what they need. So from my perspective, it aligns with, you look at the health accord piece, like we all know, huge focus on determinants of health. That is not new, let's be clear, we all know that. But how do we use this as an opportunity to align what we're trying to achieve from all of those policy fronts? You look at the housing and homelessness plan, you look at the work towards improving educational outcomes, like all those policies, they're all trying to do the same thing for vulnerable populations, again, like I said, just from a different angle.
Yeah, for sure. It's been a long time thinking about all of those things as well. And you said earlier, you talked about a systemless system. I don't think those were your exact words, but more or less. And so how do you see that systemless system evolving? What's your vision then for what integrated youth services could look like in 5 years' time?
Well, right now in our province, we're really clear. Matt did a great job describing all this, so I didn't have to. As we've been working for the last 5 years, kind of learning, growing. Most of what's operating in Choices of Youth, quite frankly, has been copied, stolen, borrowed from other parts of the country, just as it should be. Why would we start over on anything, right? There's too much good work, too much innovation already established in our country. I just want to borrow it, steal it. Sometimes get people to come to Newfoundland and collude. We seem to be good at that as well. People like Newfoundland, which is wonderful. And Labrador for my Labrador friends. I'm from Labrador as well. So I think that is key in terms of how to work with communities to respond to their needs. So this is not even transplanting what's worked at Choices directly into communities around the province. You have to really work, really understand. It takes time, it takes engagement, and then be open to what they come back with. Similar to, many of us in this room are familiar with the concept of, housing first, and then, we did a lot of work with the Canadian Observatory and Away Home Canada around the housing first for youth model, because we all know housing for youth looks different. But one of the key pieces, because what doesn't work is then say, okay, well, I could just change a sticker now, I'm housing first for youth. No, like there's certain fidelity, the core elements are really important, the rules matter. Without rules, flexibility equals chaos, but with rules, flexibility is the sweet spot of nuance and what works for specific communities. So I really see this vision around creating a network in our province, starting with 4 sites across the province in the next little while, working from a common set of principles, fidelity to a model, but then being able to layer in the nuances specific to the region that the site is in, or specific to the community that a site is in. That's where you really begin to make sure you're also covering off those local community needs. So I see this vision around a system, a network that is also then connected to other parts of the country as we continue to grow and learn and evolve. The journey at Choices of Youth own hub site, which will be one of those going forward, there's no end in sight. We continue to evolve, we continue to learn. I told you the story of the origin story. Was like, we didn't know what we were at. We didn't know, we had never heard the term integrated youth services. We just knew that it was better for young people to concentrate supports and resources so they didn't have to go all over the place to look for them. That was the basic principle. So I see this vision where we then collectively begin to learn from other folks in our network in Newfoundland. So we continue to push forward in terms of doing better and better and better for youth and vulnerable families in our province.
What about you, Joe? We've got a couple more minutes left, and we'll have some time for questions still. So, what's your
Sure.
vision?
So, I think we have an opportunity that we've never had before to really learn all from one another and really move forward on achieving better outcomes with and for youth. We need investment, obviously. In Ontario, I think our goal would probably be like 150, hubs. It's a lot. But, we need to think in Canada, most of the population, we're a huge country with population distributed everywhere. We really need to think about innovative models of meeting the needs of young people distributed across these big geographic areas. It's going to be a combination of in-person kinds of hubs, virtual services, and innovative models where we're doing different interesting things, like you mentioned before, like mobile services and leveraging existing community resources. I think we need we need like 400 hubs across the country. And I think we have the opportunity to do that exactly as Sheldon's been saying, not by each working separately, but in fact by all of us working together and learning from one another and continuing to just kind of build up and up and up in terms of our knowledge, our innovation, our new practices, and of course that's all in collaboration with youth and families and community.
Really expanding that network of networks, right?
Exactly.
Okay, so we have another few minutes before we're taking a break. So, not minutes?
Behind, so you have till 10:45.
Okay, we have extra time for questions. That's what I love. All right. So, because I was afraid we're going to have to rush. And look, we've got hands up front already. So, I think we've got a runner mic. There we go. Awesome. Okay. Yeah, right up front, actually, just right here. So introduce yourself, ideally, and then you can go ahead with your question.
Okay, my name is Annette Breen. I'm a social worker with income support. I'm wondering, with these networks, what formalized or informalized mechanisms do you have in terms of supporting youth in connecting to income and housing?
Definitely. So we have a range. So every community, the sort of model, the formal part of it is there's an expectation in each community that all of the organizations who serve young people aged 12 to 25 come together around a common table to form the network that will operate the hub. And from our perspective, that has to include income support and housing supports. Those are essential, especially for our most vulnerable young people. Having said that, the networks do vary. So, like, we do a fair amount of work with each community to try and make sure that all of those pieces are meaningfully engaged. Within a hub, youth are able to access income support, housing support. We have a whole range, though. Like we have one hub we're about to open that has actually 2 emergency beds in it, which will be a first for us. So that's not what we've typically done. Formally, they're supposed to be there. I say informally, I'm sure there are some hubs that are not fully there yet, but it's a critical aspect of providing adequate service to young people.
Thank you. Any other questions in the room here now? We can get a mic over. Just right here.
Hi, my name is Evelyn Tilley. I'm the director with Mental Health and Addiction Services here in Eastern Health. I want to thank you both for your comments today. I was part of a team on the Burin Peninsula who redesigned our services to a walk-in model. So now nobody has to wait for service. We have no wait list, and Sheldon, no no-shows. But I remember at the time it being a tremendous amount of work to shift the mindsets of the people who work in our systems. I really liked your examples this morning, Sheldon, yours about, if we had young people who needed a service, what would we want? I love the helicopter example, because if you drop people, we wouldn't know where to go. How do we start to shift the mindset of our systems? Because in Newfoundland and Labrador, we are very much system-based. We don't do this because another department does it, or another system does it, and we don't step outside. How do we start to shift our mindset towards working differently?
You go ahead.
I'm going to use an example from Towards Recovery. I'm not sure what number it was. It was an express line. The system will transform to working from a harm reduction model. We all know the work of Towards Recovery is concluded. We also know the work to truly transform every aspect of our system to work from a harm reduction, recovery focus, that's going to take a long time. And I think we just have to acknowledge that, right? Not necessarily see it as a failure, although the consequences for people who need services, it's real and it's live and it's tragic. Let's be really clear. But it takes a long time. Systems don't change easily. We know that. If it were otherwise, we would have done it a long time ago. So conversations like this are incredibly important. The policy work is really important. I never thought in my lifetime I'd ever say that as a younger Sheldon, but it is really important. But it's all got to be on the same page, right? And the willingness to innovate. Choice of Youth, I'm very proud of this. There's no ego involved. We are known, we're a very innovative organization. That in and of itself is great. But I think what really makes it wonderful is that it's innovation with a clear focus on it is our responsibility to continuously evolve to meet the needs of young people. We have to be able to do that. So I think it's just continued effort. Transformation takes a long time. But that's butts up against, but the real consequences of not having that transformation is real for people on a daily basis.
I'd say probably 3 things, and maybe they're the same things, but said slightly differently. I'd say yes, it takes forever. And my observation is that youth mental health, everyone can relate to having an important child or youth in their family in some way. And that this is the kind of thing that's easier to get some movement around because everyone can relate. than some other things. And so really helping people, as Sheldon, set the stage this morning, to think about real people, I think is helpful. I think really thinking from a partnership perspective, one of the amazing things, and Ian Boeckh will be part of the panel, the Graham Boeckh Foundation and other big philanthropic organizations, donors, Bell, RBC, and other family and other organizational donors are willing to step up. And that gives us kind of leverage, right, with government. These public-private partnerships, when done well and done ethically and for the right reasons, can really help us transform, because philanthropy can invest in ways that government can't, in new ideas, in trying new things, and going in ways that maybe they're not ready to go. So I think that's been useful to help us move faster in this area than we've ever moved before, I'd say. And then lastly, I think we know more now from an academic perspective. This whole field of implementation science has more systematically examined how do you do system change. And I think there have been some important learnings. A lot of it's not maybe so relevant to our kind of work, but some of it is. And so I think taking what we can from that and applying it, I think, can also be helpful. So again, it's kind of like integrated youth services. It's like you kind of take the best of all different kinds of ideas and bring it together. And then I think, I'll say one more thing, which is just like, I've really tried to, this seems really obvious, like think of it as a partnership with government and move away from the idea of I'm seeking funding from government, and like we have that kind of relationship, funder-recipient, to really like we have a joint interest in better outcomes for young people, and partnering in ways that mean there are times I do things for them that are completely unrelated to integrated youth services, because they're interested on what's the evidence for this or that. And I use the skills and experience I have to answer that question, even though I don't have to. I do it because we're in this together, and if I help them, they're going to see the value in the work that I do, and not always through money, right? But the strategic leadership. So that kind of partnership, I think.
That's excellent. Any other questions in the room or online?
Well, online, if we could go there
Okay,
first.
sure. We'll get you in just a sec.
Hi, so we have a question here from the YouTube chat. Do you see your efforts as advocating for parity for mental health care? The two-tier system means ever-increasing inequity between those with means to access private care and those without.
Certainly from my perspective, that's an aspect of everything we're trying to do here, right? We're dealing with, in our case, vulnerable young people who, we all know in our province, for example, that there's a challenge for anybody to find family physicians and family care, and I know the province is working on that. Where do you think our youth fetch up in accessing a family doctor? Right. So absolutely, that is and I know Joe speaks a lot about equity and everything they do as well in a very specific way, which is wonderful. I hadn't heard it put that way before, Joe, so it's wonderful. But that is actually truly an aspect of like poverty, the implications of poverty, the implications of struggling with childhood trauma puts you at a tremendous disadvantage to accessing any form of care in a healthy way. And on top of that, we're going to give you a very complex system to navigate when you are at your most vulnerable. Like that's how this is organized, people. Like, and it's difficult enough for us. We pay people to do this work. It's maddening for them to try and navigate systems. If you're a young person, you got trauma, you got all these pieces, plus also you're young, just inherently. Like, what a disadvantage we are putting people in when that is the scenario they have to face and figure out. We're spending a lot of money in systems navigators. Fantastic. But I guess the only drawback I see in that is it assumes the systems is as good as it can be. Therefore, we now need to pay people to navigate an overly complicated system. There's something probably not efficient use of resources in thinking about it that way. Can we not kind of address the system complexity. IYS is a fantastic example. So that money that we're now spending on navigators to navigate a complex system can be spent on care.
And I would just add, if you ever said to a parent whose child was just diagnosed with cancer, we have a nice waiting list. You should call these different organizations. You can wait for 18 months before your child will be served. It would be absolutely unacceptable. And yet, the rates of fatality associated with mental health and substance use far, far exceed mortality rates for cancer, childhood cancer. So, yes, we absolutely need equity in funding across healthcare. Thank you, whoever asked that question. I don't even know where am I supposed to look for the cameras. Like,
They're everywhere.
Okay, that's creepy.
We've got time for one more question, but what I'm going to do is, because I know we have two, one online and one in the room, and so I'm going to get both questions asked, and then you guys can kind of answer
We'll
both
try to
at
be
the
brief.
same time and be brief and, tap dance away. So we'll go online first.
So the next question is, do you see a meaningful move from a focus on crisis response to prevention? Are housing first and broad harm reduction principles foundational in practice here now?
Okay, and we'll get the mic down to, it's Fraser, right?
Thank you very much. My name is Frank. The first thing I want to do is commend you on just even on the topic. And the reason I came was that the importance of the impact and potential of regional. It's not a bad word, by the way. It's a good thing to do. And I'm saying that, one, as a founding chair of what's called Avalon Employment Incorporated in the province. It provides employment and employment services to persons with disabilities and autism. And I look at the importance of regional, because I'll go back, that's 30 years ago it started. Now we have 19 of these corporations in the province. And I'll go back to another comment you said about the lack of resources. If you don't manage what was started 30 years ago, in my case, you'd end up having something like municipalities, Newfoundland and Labrador. And all the money that gets used but not efficiently in providing the service direct. So then the concern I have now is, how do you now take those 19 groups to form a regional concept without, because then the money is going to where it belongs, or it should be, right at the need, not in the administrative side of it. So again, from the point of view of Sheldon, I got to say hats off that you're driving what should be one of the best concepts going through within our province. And I think the regional concept, regionalization is a good word, and I'll commend you for it.
All right, in 3 minutes or less.
3 minutes less on the first question. I mean, I think like harm reduction, it is a work in progress. I think, we're seeing a lot of movement around housing first, harm reduction. I mean, we're clear, housing first is first for a reason. It's not housing only, and there's an active conversation. We need to continue to improve coordination of services from a housing perspective. There's our partners in Home St. John's and Newfoundland Labor Housing. There's a healthy dialogue going, but let's be clear, we're not there yet. One of the challenges on housing is, I remember telling a story, I've told a bunch of times, we had Mark Trotz here from the city of San Francisco 15-ish years ago. He was here because he worked for the Department of Health of the city of San Francisco. He was here because they had figured out that dollar for dollar, the best money they could spend towards the determinants of health is the Department of Health getting into the development and operation of affordable housing. It's like, it is in all things, right? So we have to continue to move around what does truly, fully, a system of housing and housing first in our province look like. It dovetails nicely with IYS, because guess what? IYS in Gander, if a young person is still homeless, they still end up in St. John's, because this is the closest shelter for male identifying youth, and this is the nearest shelter for female identifying youth, is both in St. John's. So it needs to be a holistic approach around how this ecosystem connects to those other ecosystems around housing, around those, there's innovative spaces happening in all of those areas. So I can say it is a work in progress. We're better off today than we were 5 years ago. We have a long way to go on that front as well.
Joe, final thoughts?
Yeah, so absolutely. I think operating as a learning health system creates the opportunity to tackle lots of different aspects of care, including, and in Ontario, we've been very fortunate to be identified as now the organization who will roll out some really specific prevention and early intervention initiatives that are going to be rolled into IYS, but with their separate funding. And it's really that commitment to outcomes that I think is essential. And just to echo Sheldon's comments, the return on investment is absolutely clear. Prevention and early intervention are the way to go.
Absolutely. All right. Well, we are able to take a little break for now. We're going to get back into the discussion. So there's more of this to come with a big panel after the break. I'm just looking for Jen. Is it 15 minutes now for a break or 30? It's going to still the 30. Okay. All right. So you got 30 minutes to take a break, grab some refreshments, and we'll meet back here for the panel discussion. Thank you, guys.
So there's more food and stuff in the adjoining room.
Traveling Roadshow. Really good. Yeah. Although I spilled water on it in the left. Oh no! It didn't die. It was scary, and it wasn't mine. So lots of tap dancing around that. Yeah. I was about 5 minutes in. You kind of sabotage yourself. Oh, yeah. It's a good icebreaker with the crowd. I do well when I make fun of myself. Oh, my God. But I even said, you can see in the open beavers, big fancy quarter table. I hit my glass right down the table. Not mine, though. Nope, seems to be right crowd. Hey, I made it. Thank you. Wonderful. Okay. Hi, Rob. Meet you. Ah, good. Nibby. Okay, I can do that. Well, look, I committed early to you guys, but I looked at the early agenda and I thought, oh yeah, I can do Ocean Defense at 8:30. I can be yeah. I was in Marystown on Monday, we had the OECD on Tuesday. This time of year is always fun. Yes, and I think the idea is I'll let them say more about themselves. I'll get them to do that. Yeah. So in fact, I'm not really worried about pronouncing the last name. Yeah. Oh wow. So I don't mind being at the podium. I've done I'm hyper, blocking my knees. Well, you know, podium it takes away a bit, but it's a flat room. A lot of people can't see the tables anyway. And if I'm standing, especially with Q&A, I have better control of the room. Yeah. 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 Yep. Yeah, really. Yep. And with Q&A, and you probably know well enough to know me, can't embarrass me. So, you know, if I'm someone I've ignored, say, no, Rob, there's someone here first. And feel free.
And we have those online too, so Chris
Right.
in that corner, so feel free to make it known that there's post now, just good to go. Post just
And we will still finish at 12:30. I'm easy. So we'll go 12:45. Yep. My notes. Rely on nothing by memory. You have a long enough lunch break? Yep. Starting. I can track as it goes. Yep. And for me, I'm not an expert in this topic area, but there's a lot of overlap with stuff we do. I can be naive and focus. Okay, sir. Oh, I was diplomatic when the introduction broke. Come back and bite him. Yep, it's up. Not a problem. There's an election. Obviously.
Ridiculously, really.
Welcome back, folks. This is a 1-minute warning that we will begin in 1 minute. 1-minute warning to take your seats.
So you'll introduce me first, okay? You can keep that brief, no need to. Oh, good. Oh, that's good and short. I like it. No, that's good. Yeah. Sometimes it's too long and you can tell I can't hold down a job.
Not yet. No, not yet. Not yet. Sorry. Welcome back, folks. If you could take your seat, everyone take their seat. That would be awesome. Your 1-minute warning is over. I'll give everyone another 15 seconds. I'm very generous. Absolutely. We had a wonderful morning. I was looking at Jen Crow back there. She's a hand talker. I didn't know if you were telling me to do something or... Okay. We had a wonderful morning. The keynote speakers were outstanding. I'm sticking to some of the comments I made at the very beginning of the day, that I honestly do think from my heart that it is easier for people to focus on negative things. And maybe not in a big group, but then you go on the side and you know, those conversations naturally happen. I think we all got to put an effort into being positive and sharing that scary word love to one another and to the youth that we serve. I think Joe and Sheldon hit the nail on the head when they both say that people who are working with youth need to enjoy that. I think that people working with everyone needs to focus on love. I think we're going to move forward at the speed of trust. Youth trusting the work that we do, and all of us here with so many different portfolios trusting one another. I'll challenge you all, before I got to read something, I'll challenge you all to leave here today. I do this every day at work. I pick one or two people and I say something nice about that person. I'm kind of giving away my secret to some of my colleagues now. At home and at my employment, people call me Mr. Rogers or Mary Poppins. I'm very good with that and I'm proud of that. In fact, if I get angry and say the word poop, people know, oh my God, Matt is angry. But I am proud of that as well. The only time I do get angry is when I watch the Toronto Maple Leafs, because I love them to the bottom of my heart. I'm sorry if I alienated myself a little bit at that point. I want to read something, and then I'll introduce somebody. Dave Banfield, I was talking to him. I said I was going to say your name. He's over here, a colleague of mine, incredible colleague, housing expert portfolio with Choices for Youth. On Wednesday nights, we do a community supper. And then there's an email that goes out every morning just about what happened. And if you want to know what IYS is, here it is. And then we can all go home, because this is the answer right here. Good day, Choices folks. Last night was another successful community supper with 49 youth in attendance. The evening was filled with games, meaningful conversations, and delicious food. Lois and our awesome kitchen volunteers prepared an enjoyable feast of ham, mashed potatoes, and veggies. 45 youth and 9 staff had a fabulous meal. In true Wednesday night interdisciplinary practice, Dr. G, as I call her, tended to 6 youth medical needs. Harm reduction nurse Steve consulted with 2 youth, and our in-house counselor Ken had 3 drop-in counseling sessions. A great success story indeed. That is what Integrated Youth Service is about right there. It's having people come in, you're enjoying a meal, you're enjoying each other, the love is there, and you're helping. And they don't have to go to 14 different places. It's right there. So I am proud to be part of Choices, and that organization is great. I'm going to introduce Dr. Rob Greenwood in a moment, but first, the panelists, you know who you are. If you don't mind coming up and taking a seat, please, right now, that would be great. All panelists, please, we can welcome them. We're going to officially welcome them in a moment, but oh, we're short one. Oh, okay, we'll see. All right, so now to lead and moderate this wonderful discussion, welcome Dr. Rob Greenwood. I do have a little thing here I want to read. Associate Vice President, Public Engagement and External Relation, Director of the Harris Center, Memorial University of Newfoundland, who will moderate the remaining of today's gathering. It was the first time I got a chance to meet Rob in person was today. This dude is so funny. I can't wait.
That's kind of an introduction you don't want to have, because now you got to try to live up to it. Although I did have a line I want to start with. Well, first, go Leafs, because I also have that genetic inheritance. I said several years ago to my son, who's 31, Luke, boy, I think we're going to have to find another team. And he said, Dad, you got to stay there during the hard times. I said, Luke, I've only known hard times. But we'll see. Also, Matt, clearly a positive life force, and I often get accused of being glass half full myself. And some people say, well, get a smaller glass. So there, I've done my funny bit. Delighted to be here and partner with Choices for Youth and all this great gathering on this really important topic. So it's a real pleasure. Kathy, I know, handled it wonderfully this morning, and she's a Choices alum. And so we have a lot of integration, and we're kindred spirits in these organizations for sure. To get us started, I'd like to invite each of our panelists to introduce themselves, sharing their names, pronouns, and how their work aligns with Integrated Youth Services. I'd like you to do that briefly. And we'll start with Ian. Oh, put that mic right up in your mouth. And I'm going to be that's what I do for a living. I'm a real pain. So I'll keep reminding all of you throughout. Over to you.
Hello, everybody. Ian Boeckh from the Graham Boeckh Foundation. My pronouns he, him. And our foundation has the privilege of supporting and fostering integrated youth services across the country.
Thanks, Ian. And you can pass it to your right, and then we'll work our way back across.
Thanks, Ian. Hi, my name is Dr. Françoise Guigné, or Dr. G, which was a name given to me by one of my patients, and it stuck forever. I've been working at Choices for Youth for almost 4 years now, and anybody who knows me, who knows that I work there, know that that part of my week is just like the rest of my job as a family doctor is really my dream job. And I'm part of the integrated youth service team on Monday afternoons and Wednesday afternoons.
Thanks. We'll go next to Ian, and thank you, Dr. G. I'm also sometimes called Dr. G, but I'm never called Françoise.
Well, Alan. Good morning, everyone. My name is Tiana Butler, and I'm here from New Johonuk, which is where the waves roar and tumble, otherwise known as Bay St. George, Newfoundland. My relation to Newfoundland and Labrador Integrated Youth Services is that I'm the regional manager for Labrador and Western NL, so I'm supporting communities as we grow and move forward on this journey together.
Thanks, Tiana.
Hi, folks. My name is Jen Crow. My pronouns are she, her. And I'm the manager of strategic initiatives at Choices for Youth. So I started doing a lot of the great work that Matt was doing a few years back in building out the IYS model and a lot of stakeholder engagement. And now my team supports a lot of the impact measurement work associated with IYS and the strategy. It's great to be here.
Thanks, Jen.
Hello. I'm going to struggle with this. I'm a hand talker. My name is Travis Mitchell. So I coordinate a mobile harm reduction outreach service in the Clarenville-Bonavista Vista area called the Rural Initiative Outreach Team, or RIOT program, which is an extension of the existing SWAP program through AIDS Committee NL.
Thanks, Travis.
Hi, I'm Kathy DeYoung. I'm an assistant professor in the School of Social Work at Memorial University. And my connection to IYS is that I'm going to be working on a grant with Choices for Youth through CIHR, who've offered funding for the initiative.
And I am Matt Piercy. You've heard me up here. I'm the Director of Integrated Youth Services. I am so privileged to be in with all of this knowledge here. I feel like I'm the odd person out. This is just an incredible wealth of knowledge. So please ask many, many questions. And I look forward to chatting with everybody that's here today. Over to you, Rob.
Super, thanks. And you can get the mic over to Ian, just because I'm going to pick on him first in a minute. Before that, though, just to let the audience know, you need to be thinking about your questions as we go through the panel. And I'm sure many of you have them already, and or your comments. There's tons of knowledge in the room, so we want this to be a dialogue, and that's where the real learning happens, in my experience. I've got a few questions that our colleagues have helped me get ready for to get things going. And we will have, of course, the opportunity, people online as well as in the room. So we'll get back to all that in a few minutes. But I'm going to start with Ian. And the question to get us going with you, Ian, what are some of the trends that you see nationally when it comes to the needs of youth? And what is the role of integrated youth services in addressing these needs?
Sure. Well, I'm going to try not to repeat the great things, that Sheldon and Joe talked about, but where we are now with youth needs, of course, is a long time in the making. There are long-standing gaps, especially for that age group, transition age group, lots of, Indigenous people, rural people. And then, as Sheldon said, something started to happen, I don't know, like 15 years ago or something, and the number of people needing help and coming forward has gone up hugely. And then we had COVID, and that just put the whole, the needs and the crises kind of on steroids. And so, we're here today with lots and lots of needs. It's very big. Fortunately, as Joe's talked about how the kind of origins of this work. So, several years ago, our foundation had the privilege of kind of creating a national network to not just figure out how we could serve youth better, but really have a fresh look at what would a system look like that would really be able to serve youth. And it was pretty much unanimous across the country to work in this kind of team-based way of quality services and a holistic view of youth. And it's what I call, it's building the village, but building the village in a much bigger sense in terms of, at the community level, the network, and building provincial networks and pan-Canadian collaboration. And so, It's just incredible that integrated youth services is scaling really rapidly across the country. There's probably 60 community networks now that are open, and governments are really scaling this rapidly. So, we can see all these sites that are funded and are under development, and I would say we're probably going to be at 150 community sites in 2 or 3 years. All the provinces have IYS initiatives that are scaling up or under development. And one of the really wonderful things, as you can tell from Joe, is that integrated youth services is actually, this is an area 10 years ago that was in the wilderness, kind of. And now, through this work with integrated youth services, it's actually being seen as a leader in a number of areas, like team-based care, addressing long-standing equity issues with different vulnerable populations and rural and Indigenous youth, developing an alternative workforce, and then this really exciting work that is upcoming about measurement-based care and a learning health system. So I think that, and just the fact that integrated youth services is scaling so rapidly in this kind of COVID and post-COVID environment of a workforce shortage, I think is a testament to both the needs for this, but also the design, which is because it's been designed to be able to be implemented in so many different types of communities that you can actually do this now with the alternative workforce and using the resources that are there and getting them to work together. So, I'm part of philanthropy, and we also work with a number of other philanthropic organizations that are supporting integrated youth services. And sorry, okay. We believe, that we need to work together to build the village in a bigger sense. And so we're also walking the talk and working together and supporting integrated youth services across the country. And we're excited about supporting the work here, not only to get it going, but also so that we can enable the sharing of all the great things that are happening here with the rest of the country.
Super. Thanks, Ian. You can hand that very important mic to Dr. G. And Dr. G, you are working at the Carter's Hill Integrated Youth Services site. I grew up for a lot of my youth on Freshwater Road, went to Holloway School, which isn't there anymore, and I had a really good friend lived on Carter's Hill. So that's my turf. And that site, which includes clinical and wraparound services, how are you seeing the integrated model play out in practice?
Thanks so much for having me here. I think that in the last 3 or 4 years, we've seen a lot of innovation come out of the Carter's Hill and Choices for Youth. My personal experience coming in as a physician who has always been interested in working with underserved populations, and intentionally came back to Newfoundland, born and raised here, trained elsewhere after medical school for my family medicine training, and then came back explicitly because I wanted to work here. It was really exciting to work with the staff at Choices for Youth. It has always entirely been 100% positive and client-led. It just always solution-driven and with like this incredible energy for innovation. And so what that looks like for us, I mean, we mentioned last night, I guess, to give an example. So unfortunately, I wasn't able to get to the full clinic last night as an exception because I was teaching beforehand. And so even though I was only at clinic for an hour and a half, I saw 6 people, which is a lot of people considering the complexity that we have there. But we can see the people that we do see and meet the needs that come because we have such an amazing team. So our outreach staff are absolutely incredible. Their skills are the scope, it's really difficult to describe, to be honest, because they're so creative with what they can do. But, across the board, every outreach worker I've ever worked with has just this amazing sense of understanding for the social determinants of health and this real empathy and ability to connect with people and build trust really fast. I loved that comment about we'll work as fast as trust lets us, and that's, I think, a really great explanation for what happens at, for example, community supper. So I let the outreach workers triage who comes to see me. There's usually a few people I have on my radar. I give the names of people I haven't seen for a while who I know have active medical issues that need follow-up, but that those people, for a lot of different reasons, don't fit a model of appointment-based needs being made. So that radar list is really helpful, and the staff are amazing. They'll knock on the door and they'll say, so-and-so's here. And so we'll just rejig everything and make it happen. But because of that, we follow people with very complex mental health issues who can't go to the peer program for regular follow-up. So we do a shared care model by default where I connect with the psychiatrist, send the notes from my clinic, but provide the injections or whatever it may be needed. And the collateral often comes from the outreach workers who know the people best. But that extension goes beyond the doors of choices because our outreach staff and are collaborating, like our mental health counselor who's on site and our family health counselor who's on site and the harm reduction nurses who are on site have some connection with generally people who are hard to reach, but in other circumstances. So we've created this incredible web of information that supports people when they're really hard to meet. What I've seen in the last little while, the pandemic was really hard. It really meant that we dug deep for innovation to try to figure out how do you actually do virtual care with a population that doesn't have phones or an address. And so we came up with a system that both met a walk up to the door model and put your name on a list and make sure you've got access to phones and a delivery of message system when people were getting meals dropped off so that medical knew how to reach people. And it only worked because of that integrated service model. It was when we broke out of that and the pandemic let us see people again, we did it as fast as possible. We knew we needed to see people in person as soon as we could, and so we allowed that to happen. But even then we had an appointment-based model for a while, and for me, I'll never forget the difference from going from an appointment-based model to a walk-in model. I see twice as many people, and I see new people every week, and we're dealing and supporting people who have complex addictions and mental health in a way that we couldn't do with an appointment-based model. And so we're very effective with our time, but it's so professionally satisfying because I don't think there's ever a visit that comes up where somebody doesn't mention some sort of financial strain or housing strain or things that are kind of outside of my wheelhouse where I don't know, I know roughly who to refer to, but it's so different. I say, well, is it okay if I just bring Karen in? Can I bring the outreach worker in? I think we can sort this out. Or maybe we have a grocery card. Or maybe we can figure out how to solve this medication situation and figure out the transportation around that. And to be able to meet the social determinants of health in the moment while dealing with multiple different chronic illnesses or acute illnesses is just the best form of care, because people can't really go and fill your prescription if they have no house and that's what's worrying them. Or it's great to work somebody up for weight loss, but if food security is at the root of that, how are you going to address that? So I think that, for me, knowing that we're meeting hard to reach people and knowing that we can be creative in the space that we have is just, it's very motivating. And I find I'm energized at 8:30 at night when I'm done my clinic. I'm not keeping the staff there till 8, just so you know. We're very good at that, at boundaries, but I'm doing paperwork until 8. And I just think it's really nice that when I come home, even though it's been a long day, to know that we were able to start someone on Suboxone tonight, and that I'm going to see them next week, and we're going to look at how we can safely prescribe ADHD medications in a way that's more supportive, very patient-centered, while also supporting a comorbid addiction situation. And so I think the people who are coming to see us, we've developed enough of a reputation that we're non-judgmental and meet people where they're at. There is a lot of stigma around substance use, and oftentimes you hear physicians and other healthcare providers talking about drug-seeking behavior. And I never, what was taught to me as what drug-seeking behavior I've never seen at Choices for Youth. And what I do see is highly motivated young people who would like to meet goals in their life. And the fact that we can do that, it's not because I'm there, it's because I'm there alongside Karen from Outreach, who's alongside there from Harm Reduction, Steve, who will see that person possibly on the other side of town tomorrow and can follow up and, did you see the x-ray? Dr. G's looking for you, and I know you have no phone. Do you mind if I call her right now? I know where she is. Text message to me. Yep, no problem, put him on the phone. And so, and it's also because of the counselor that we're working with that we can give that wraparound care. So we've got an amazing thing going here, and I think if we could reproduce it, I think we'll see incredible health outcomes. Thanks very much.
Thank you, Francoise. We can get the mic over to Travis. And Travis, Harris Center does a lot of work in rural and remote, and I know that's an area of focus for you. So from that rural, remote perspective, what are you seeing on this? What are the barriers to access, and where are the opportunities?
Ditto. So with our service, so we provide health and social related services to individuals who are underserved and often overlooked in our community. So it could be anybody who uses substances of any kind and in any way, individuals experiencing homelessness or precarious homelessness, individuals who are incarcerated or recently released from incarceration, or individuals who work as sex workers. So I like what you were saying, actually, Dr. G, about stigma, because arguably I would say stigma is our biggest barrier. However, I don't think that that's unique just to Newfoundland. I think that that is very much rooted in not only how we have been socialized to talk about substance use in general, but also people who use substances. But those do have ripple effects. We see it in a more rural setting where individuals don't want to rent to someone who has a certain last name or because they're well known. And similarly with employment, people don't want to hire certain individuals because they have a last name. But this also goes into healthcare settings where people don't want to even go to an emergency department, for an example, even in situations where they probably should, so it's like opioid poisoning, for an example. So, or when their health has deteriorated so much, like they're still not wanting to go because of stigma, and they're really worried about how they're going to be treated when they get there. So with our service, so we are a harm reduction service, so we do provide safe injection, safe inhalation equipment, naloxone, and fentanyl and benzo test strips, and collecting used supplies. So preventing STBBIs, so sexually transmitted bloodborne infections like Hep C and HIV, are definitely a priority of the service. However, we're really trying to take this kind of like bottom-up approach and humanizing substance use and just talking about when we're engaging with folks in the spaces that are most comfortable for them, which is typically within their home or their personal dwelling, that we're here, we're in front of you, you still deserve love and compassion and care and support, and taking that full harm reduction support approach where it's like, it's not about me, I don't have a goal for you, the goal is you. You are your own expert. What do you need? I'm here in front of you, and let's connect you to those wraparound care supports. Sometimes harm reduction gets added into policy like as a buzzword more than anything in trauma-informed practice as well, rather than like a fully implemented strategy. And sometimes that also means that we have this kind of like approach where it's like, we're gonna do harm reduction until we can get you to abstinence or something. And we have these own personal goals. That is not how our service works. Like, you are your expert, what do you need? And that's what we're there to support. The last little bit, I would actually like to go back to Dr. Henderson's presentation when you had mentioned respect. That is a two-way street, and I don't think we sometimes think of that as a service provider. And I think back to like when you go into like a public service building, sometimes we see all these on the walls where they'll have like a thing up where it's like, we expect this, and we're not going to tolerate this and this and this and this. We have all these rules and guidelines that are already there. However, when the person gets to their care, it's not that, like, there's no sense of reciprocity where it's like, no, you also are going to get respect, and you are also going to get care and love and support. So that is a very two-way street. So when you're working with individuals who use substances or anybody who's experiencing system-imposed vulnerability, it takes time to build that trust and rapport. So it can't just be this one way where it's like, you will respect me and then we'll go there. Like, no, like it has to start at the ground where you also deserve that love and respect. So I hope that answers your question.
Great messages. And we'll get the mic over to Matt actually next. And Matt and Tiana are at work on these issues provincially. And so we'll start with you, Matt. What's your vision for a provincial model of addressing the challenges that Travis and others are speaking to?
Sure. I'm going to stand up, and it's not because I like attention, but my partner Carolyn would say I do like attention, but I like looking at people when I speak. So I'd rather stand up and do that. So thank you for that question. I'm going to answer that in actually doing thank yous. I want to thank, I was thinking 4, but maybe 6 different things that kind of represents how we're really rolling out integrated youth services in Newfoundland and Labrador. There will be no way to move this forward without an incredibly strong backbone agency, which Jo spoke about in her province. Without the support and knowledge and passion of Choices for Youth, led by Sheldon and all the team that you see around here, there is no way that this could work. That's the very first thing that you need in your province in order to move this initiative forward. They provide everything from admin support to strategic direction. Me and Matthew Cooper right here, we did a tour across the province working with our steering committees that I'm going to talk about in a moment. We couldn't do any of that without the support of that backbone agency. So right at the very top, that's what needs to happen. I'll move into the steering committees. So around this room today, we have representatives from 8 steering committees that are located throughout our province. And we've been working hand in hand with these steering committees that are made of government, community members, individuals with lived experience, and so on and so forth. Without those dialogues and building the trust that Travis mentioned, this would be impossible. We would be offering a service in a region that becomes part of another service. This is an entirely different way of doing business. As Dr. G mentioned, I could not say it any better. You're coming in and working together, merging all those portfolios so that you can really service the youth that we're trying to service. So that, without the steering committees, it could not happen, and without the trust that we've developed with them. As I said, Mr. Cooper and I and others, our regional managers, went through the province and worked on logic models. What incredible conversations we had with community about services that are offered, about needs that we need to address, and how can we do that? Asking these whys and hows. It was essential for us to move forward. I want to talk about, in order to make sure that I'm doing my job right and our staff are doing our job right and we're doing all these things, we have a very strong guidance council that oversees the work that we're doing, and that's comprised of not only people from Newfoundland and Labrador, but from across Canada that are experts in what we're trying to do and ensure that our vision, if we're steering off of our vision, well, we're course corrected and we're moving forward. So that's an essential piece. The key of all of this is our Youth Advisory Council. We have the fingerprints of our youth that are using our services all over everything we do. I had mentioned we're spending this weekend at a summer camp in Salmon Air Line with our youth so that they can tell us, how are we going to move this forward? How are we going to meet their needs? Without that, there's no direction. They are the compass that's going to guide us as we move forward. Those voices, and we've done a lot of work, hats off to Tiana and Krista, who's out here somewhere, our regional managers, for really working on building that trust so we could have those amazing conversations. So those are really the pieces that are all working together to move this initiative forward. Hand in hand with government, we could not do this without our federal government and our provincial government supporting the work that we do. And of course, wonderful people like Ian here, who brings that philanthropic lens. Without that, and not only, Ian is so passionate. It's not about dollars, but it is about dollars too. But it's not about dollars. It's about the passion and what Ian and others see as the right thing to do to help youth. And I appreciate that so much. I think maybe I just go off on a tangent.
It was a good tangent, so I think you done good.
Thank
We'll hand it over to Tiana now. And on the same vein, Tiana, in terms of your region, how do you see this model playing out in western parts of the province and Labrador?
First of all, before I begin to respond to that, I just want to acknowledge who I am and where I am from, because I am Indigenous from the southwest coast of the island. And in our ways of knowing, we always begin with acknowledging where we come from, that we come from the land and the waters where our families are rooted. And I'm very proud to be from Mi'kma'ki, to be living and working and supporting communities in unceded Mi'kmaq territory. And as part of that work, when I first came on with NLIYS, I very pointedly asked to change my job title, because too often in my regional work, I've been listed as Western Newfoundland and Labrador. And I acknowledge, although I am not from Labrador, that too often in our province, Labrador is listed as secondary. So my position, I requested and was granted to be listed as regional manager, Labrador and Western Nell, because I do want to put the needs of the folks in Labrador in front and center as well. So I do want to say that, and that's part of our growth and our journey in our province, is to acknowledge the amazing capacity that our peoples, our First Nations peoples, and their collaborators and the community members represented from settlers and new Canadians working together in our outport communities to thrive. And if you want to look at innovation and ways to move forward, you look at the small communities, because we know how to make things work with very limited resources. We know how to come together in times of struggle and stress to support each other. So I think as we move forward with IYS in our great province, that we need to acknowledge that we do have a very large population of Indigenous folks who do feel that we do not have a voice at the table all too often. And in fact, we do have a population in this province that is 9% Indigenous identified. That is third only to Manitoba and Saskatchewan. We have the third highest population of Indigenous peoples of any province in our country. And too often people do not know that. In relation to that, so we have about a 9% population of Indigenous identified folks. Currently at Choices for Youth Carter's Hill, we often have up to about 19% of folks accessing services at Carter's Hill are Indigenous identified. So that's a huge issue. If we represent 9% of the population, but 19% of the folks accessing services are Indigenous, why is that? So it's by moving forward with all of our Indigenous nations in our province to find collaborative approaches to move this forward. And just drawing the attention a little bit back to the Southwest Coast, because that's where I come from. I have been a member of community in Bay St. George for a very long time, working in community, closely related to Joe. 1997 was my start in working with community mental health and education. So I've been at it quite a long time as well. I'm trying not to age myself too much. But and I do know that we have wonderful representation from Western Health managers from community organizations such as CEN here. We've got folks from the Department of Education who we've all come together and many times forward. We have things like Community Cafe, the Bay St. George Coalition to End Violence, which at every meeting that we meet, we take 20 minutes for all of our organizations to just kind of have a round table and say, this is what's going on, this is what we're doing, how can we support you, how can we come together? And I think that's one of the things that we're going to have to remember, that sometimes, we talk about the siloing effect of different organizations. Well, we don't really see that in our regions because our organizations constantly come together to support our folks. And we do acknowledge that, we do need the evaluation and that as we progress and move forward, and the research side of it and the statistics to support our endeavors. And I do want to acknowledge that there are many ways to evaluate services, and including Indigenous ways of research and representation. So I referenced Community Cafe, and this is one of the things that I really want to highlight because this was an initiative that's been going on for some time. It was folks meeting around a table that said, how do we acknowledge and how do we support folks who are struggling with food security? So it started off as once a month, and we've built it and grown. It's supported not just by community organizations, but by businesses in the area. So all folks, no matter who they are, come in and receive not just a hot meal, but as well connections to the public health nurse. They might be able to get their flu shot at the same time. They might learn about a program that's starting up at the Women's Center, things like this. And it's an opportunity for all folks to connect. And so now it's weekly, and we have it in various locations across Stephenville. So we try to address transportation issues. So it started out, for example, at the Lions Club. Once a month, but we know that it's not always easy for some folks to get to the Lions Club, so it's spread out to other locations around town. So each Thursday it happens in a different place, and we serve upwards of 200 meals each session. And our Christmas cafe is very big. Santa comes and provides presents for folks, and we've had upwards well beyond 200, sometimes 300, who come in for a hot turkey dinner, all served to them by folks who are working in community. A shout out to our local MHA, Tony Wakeham, who's often there serving himself, and as well as Scott Reed. They come and support us all the time and often act as servers. And I think that's right there, IS in itself, right? It's the government, it's the community, it's everyone coming together to address the needs. We have what we call a holistic model, and this has been something that we've been addressing. So we need to address all needs of an individual that walks in. And our youth are struggling. We know that. We know that our youth are struggling, and we know that our youth in our regions in Labrador and Western NL have among the highest rates of self-harm statistics. We know that our rates of suicide loss in Labrador and Western NL are 4 times the national average. So our youth are hurting, but we also have found ways of coming back to the land to heal not just our youth, but our families, because no one person is going to heal in isolation. And in order for one individual to heal, the family, the community, the found family needs to work and support each other to heal. And that's the way that we're going to break down those barriers and support each other. And I love the fact that Choices for Youth is coming through to speak with all of our steering committees, to really be a part of this, to learn from each other and grow. There's some amazing things happening at Carter's Hill, and we love it, and we love to highlight that. And there's also equally amazing things happening through Stable Way in Grand Falls, and as well as at the Women's Center and SAS Women Council and Happy Valley Goose Bay and other areas in Vine Place. Shout out to Mike from Vine Place, because he's doing incredible things in Corner Brook as well. And as we come together and learn from each other and to support each other. So my call, I'm going to wrap this up, and I know I'm kind of meandering, I'm hoping I'm answering your question, is to come on outside the overpass and see the amazing things that are happening across our province as we learn and grow and support each other. And this definitely has to be collaboration, and we know we have awesome learnings that we are receiving from folks in Choices for Youth, and we have things that we would love to teach as well, and that's how we're really going to grow this in our province.
Thanks, Tiana. And we're going to go to Kathy next, and Jen. Kathy first. You two have been thinking about integrated youth services from an evaluation and research lens. I am keeping my eye on the clock. We want time for Q&A, so get you to be a bit succinct, but we have till 12:45, so we're in good shape. Kathy, what are you hoping to uncover through research about integrated youth services, and what are you seeing so far?
So I think it's interesting to speak to research given all the rich information and experiences that have been shared here today, because I want to say that it's not about imposing research onto the experience that's happened here. It's about finding a way to do research respectfully, honoring the processes that are already in place, and obviously recognizing the very valuable work that's already being done here, because there's just a lot being done, and the stories being told are really clear, I don't like this, are very clear evidence that IYS is working, right? So I think the intent of the research is just to make it better. It's to grow it, it's to expand it, and it's to take a look at, I think, pretty basic and simply, what are we doing now that's working? What are we doing now that isn't working so well? What other things do we need to be doing? And how can we implement these things in a way that we're, knowing that they're actually having some benefit? And so there's the measurement and the evaluation and the research piece of it, right? But ultimately, I think it is about developing a learning health system within our province, right? So it's about sharing that wealth of knowledge that people have. It's what Tiana has just invited everybody to do, to go outside of the overpass and to learn what's happening there, right? And so I think, once we have a learning health system that's developed and healthy within this province, then it's about extending it beyond here into Canada to share the wealth of knowledge and experience and innovation that Newfoundland has as a province. And what I've learned is that I'm very grateful to be here, and that IYS in Newfoundland is alive and well. So, thanks.
Thanks, Kathy. And over to Jen to conclude the panel, then we'll open it up. You folks have been looking into the impact of the model at your own site in St. John's. What is the data telling you?
Yeah, great. So, good question. So I really appreciate the humility in which Kathy kind of approaches this work into, and that we are trying to build out a data system. We're trying to understand, what are the numbers telling us, but that doesn't replace youth story, and that doesn't replace what young people are telling us every day about their experiences, about the impact, about the challenges. And I think the most important thing for us to do as we kind of move forward and trying to understand data is doing that in lockstep with young people, letting them guide the way. So a couple years ago when we started on this journey of implementing a data strategy at Choices, the first thing we did is we went out and we consulted with every single program at Choices for Youth, and we talked to youth. And we asked them, what type of data would you like us to collect? What type of data would you not want us to collect? And how would you like us to collect it? And what we learned was so fascinating. I think, we had assumptions going into it because we're only human, and Matthew Cooper, who talks a lot about assumptions in his developmental evaluation work. We had assumptions, so, we're in a digital age as one. So we thought young people are gonna tell us, give me an iPad, give me a smartphone, I'll fill out a survey, and then I'll come and see you. They told us the opposite. They said, the way I want to tell my story, the way I want to share my information, I want to do that in conversation with someone I trust. And I think that really lends itself to the integrated youth services model that we've been able to curate, is that when they think about a person that they trust, they think about a lot of the people who work at Carter's Hill Place, that work at our social enterprise hub, that work at the Lily building, that work at the shelter. And that's, I think, something that's really, really powerful. The second thing that we did is we tried to understand what's the type of information that we should be collecting from you. And so there's three main things that I kind of want to share. So first of all, I want to talk a little bit about who we're serving. So Tiana talked about the Indigenous representation. 17 to 19% of the youth who we support identify as Indigenous. About a quarter of the youth who we support identify as 2S LGBTQIA+. About 14% of the youth who we support identify as having a disability. And about a third of the young people who walk through our door are coming to us having experienced homelessness in the last 3 months. So that's incredibly eye-opening. And as we start to build that out, what we can learn from that data is, okay, now where do we need to put our focus in terms of continuing to invest in services? So how do we build out partnerships with organizations like Quadrangle NL, who are in the room? We now have a staff member that is a shared position between Choices for Youth and Quadrangle NL because we recognize the unique needs of 2S LGBTQIA+ folks in our community. And as we build out our model across the province, how do we ensure that we have land-based programming, Indigenous programming, built into that model to reflect what is 17% in St. John's and likely much higher as we look to grow integrated youth services across our province? The second thing that we learned was, what are we supporting young people with? What are young people coming to us with? And when we did this, and I shout out to Bob Curry, who's not here today, but is our data and evaluation officer, he pulled the report, what are our top 10 interventions from the last fiscal year? Number 1 across all our program areas, and that includes 4 social enterprise and training programs, right? Across all of our programs, number 1, mental health. And what's interesting is that while that is number 1, number 2 is family supports. Number 3 is housing, right? And the list goes on and on. Because what is important is not just being able to meet a young person with that direct mental health support, that clinical support, but it's also being able to meet them with family stability, right? It's being able to support that young mom. It's being able to support with family reconnection. It's being able to support with housing stability. It's being able to support with income, with education, with training, with employment. And it's that suite of wraparound service that the data is really telling us that's the important investment. It's not one, it's all of it together in one site. And so then the third thing we learned was about the outcomes. So, we know who we're helping, we know how we're helping them, but what is it leading to? What is the impact? And what we're seeing is really interesting, and this is preliminary, we're continuing to build this out, but what we're seeing is so interesting. So young people come to us at Carter's Hill Place, and within about a year and a half of engagement, we're seeing an 88% decrease in the amount of self-reported emergency room visits from those young people. We're also seeing about a 60% increase in housing stability. So it's really interesting to see that connection point. And I think what's fascinating is that it's not just about, a young person's going to the ER less because they get great supports from Francoise and the team, but it's also that they're going to the emergency room less because they have more stability in their lives, because they're not moving, they're not in and out of the shelter system. They have a stable and safe place to live every day. So we need to think about all the factors of stability and all the pieces that allow a young person to, you talked about setting goals, reaching those goals, and then knowing that they have a place to come back to if something happens and they need support. So it's, that data is kind of telling us a story. We're continuing to build it out. And as we expand our model, Dr. Henderson talked about that common data platform. We've established a common data platform at Choices for Youth, and we want to continue to build that out with our partners across the province so that we can tell a story that's reflective of not just St. John's, but what young people need right across Newfoundland and Labrador, and what interventions are really making the most difference. So I'll leave it there.
Super. Thanks, Jen. Great job, panel. So that sets the table really well for the Q&A discussion. If you're online, you can enter a question in the chat or in the Q&A function, and we'll have it read out. And if you're in the room, you put up your hand. Nevi is going to be kept busy running the mic. We hope she'll be kept busy. And so anybody already online with a question? We do. So Nevi, or you have a mic back there. Matt, is it? Okay, you fire away, and then Nevi right next to you is a question. Fraser. Okay, Matt, it's over to you.
Yeah, so we have a question here in the YouTube chat. What do each of you see as the biggest barriers to collaboration between nonprofits in an effort to fill in gaps in service and reduce duplication of efforts? What system change could reduce barriers?
Very good question. Most of my experience is in economic development side of things. The same issue exists. So each of you have been asked to comment, so I want you to be succinct, get to the point. We'll just start with Matt and work our way around. So get the mic over to Matt. Fire away.
That's a great question. That's impossible to answer in like very brief.
But you will.
But I will. Oh my Lord. You know, one of the things that, I'll go back to our traveling across the beautiful province of Newfoundland and Labrador, talking to steering committees and talking to government. The biggest piece, and it comes back to something quite simple, is trusting one another. I think you've got a lot of people sitting around tables, and rightfully so, have agendas. That's what they're hired to do, and have portfolios. But it's coming to a point where we can merge those portfolios like Sheldon spoke about earlier today and really focus on the youth. I think it's okay, and I always go back to Matthew Cooper as well, because he's leading this when we went across, is setting that stage to be able to disagree respectfully and learn from one another and not get backs up and not do any of these things. We toured one particular community, and before the meeting started, we were pulled aside, Matthew and I, and we were told, you know, I'm not looking forward to this conversation, and I don't really, without using the word trust, it was implied, like, what are you doing? You're imposing your thoughts on us and all these sorts of things. And we had a wonderful conversation with this person and just talked about, we're here to learn. We're here to grow together, to really have an impact on all of these things that Jen's data and stats talk about. And after we met and went through a logic model presentation with this gentleman, he pulled us aside, and it was a 180. It was, this is what I wanted to hear. Now we can make a real change and a real difference in community and really support the work we're doing. So it's easy to say we trust each other. It's a whole lot different to actually do that, and it takes a lot of time. I think that's where I'll leave it.
Great answer, almost succinct. Kathy, your perspective on this one.
So I would bounce off of that and say relationships. I think, knowing each other, being willing to see each other's projects as equally valuable, not resource guarding, because I think often that's what a lot of it's about, is we're so invested in our own work that we're not able to see past that, to see the goodness in the work that other people are doing. But ultimately, I think it's about remembering what this is all for, which is for the youth. So it's kind of like co-parenting when you're in a separated marriage, right? Where you have to put your differences aside to make sure that the kids' needs are getting met, right? And so our system can be somewhat like that, where we're in a difficult kind of separation, divorce setting in terms of the different, parts of it, and unwilling to think about we're all serving the same people. And so one of us might have to give up our agenda here and allow somebody else's to prevail. So,
thanks, Kathy. Travis.
Again, ditto. I might take this in a different direction, but sometimes I think like we might get concerned about like duplicating service as well, and as a result, we end up working in silos. Where the reality is like, if we can have and incorporate so many hands and build a basket of supports around somebody, like how is that a bad thing? But I think there's a couple of other things. Like sometimes we also get into this mindset of like, if we build it, people will come. And when you, like I'm thinking from a rural perspective, like there's a vast geography in Newfoundland, no different than Northern Ontario, where if you don't have access to things like public transportation, like that's what we're really trying to bridge with our program, is that as stigma contributes to a lot of displacement, people are being displaced in the farther rural settings, so how are they getting to those wraparound care supports? So we're trying to bridge those gaps and connect people to those wraparound care. And then the third part I would say is that I think people not having their voices reflected in the supports and services that they're accessing. And I think from like a person who uses substances perspective, a lot of time when someone identifies that they use substances, and if they identify, sometimes they don't want to or they can't because of stigma, kind of like Dr. G had said, is like they're immediately discounted. Like, you are no longer your expert, you're drug seeking or whatever. So how do we move forward in a way that is inclusive while taking that person's experience and their expertise into consideration and like working collaboratively with them instead of for them in this like paternalistic way? So again, sorry, go all over the map.
Thanks, Jen.
I think it's interesting for us to think about the role of funding in all of this, right? Like, so I would love for us to think about the way that we fund community organizations in a way that incentivizes partnership and de-incentivizes competition. And I think IYS is a step in that right direction, where it's that we're all moving towards a common goal. I have a skill set that's different than your skill set that's different from your skill set, and how do we honor that as organizations all working towards supporting youth and young families? And so how do we approach funding opportunities that way? And how do funders see that as an incredibly valuable model for going after resources? So I think that there's an opportunity for us to challenge our thinking around that. And I think that's perhaps an opportunity for us to think about solving these problems in a more innovative way as well.
Thanks, Jen. Really important, different angle on it. Tiana.
Thank you. And again, it goes back to trust and openness and honesty. And I want to draw an example that most people can relate to. Through the pandemic, we saw an increase in rapid deployment of funding, shall we say. Situations for a lot of community agencies had never had that opportunity. So what I saw happening in Bay St. George were folks coming together to best support the needs of the people who we were supporting. So for example, if I had an individual come through my door in my location who expressed the need for housing stability, and they were sleeping on cardboard, because we do have a lot of folks in our area who have beds made up of cardboard currently still. So I might have been able to supply a mattress, but I know that they also needed their fridge filled. So I might have reached out to Bernice, because Bernice had gift cards available. And then Bernice would say, oh, but you know, Sharon at the Women's Center has this happening. So we would just naturally send out those emails, or those, you know, things. We've got an individual or a family who needs da 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 da, and people would respond with, oh, I can provide that. Oh, I can provide that. And so it relates often to funding as well. So when one organization would receive funding, we'd bring everyone to the table and say, okay, I've got X amount of dollars. How can we collaborate to make this even better? And I think that's ways that we need to do that as well, that we are, at the end of the day, we are supporting youth and their families. And if we can bring what we have to the table in an open and honest way, we can support them far more effectively.
Thanks, Tiana. Ian.
Yeah, so I'm gonna give a little bit of a different perspective here, and we've heard about the great work that Choices for Youth has done in terms of building collaborations among service providers. We heard from Dr. Joe about Youth Wellness Hubs Ontario and the building of community networks. Well, one of the things that I think the speakers didn't have a chance to get into is all of the tools and mechanisms and values and stuff that are used to actually accomplish that and make sure that it's sustainable. And it's not, all of these things aren't necessarily things that are sort of public facing. But I would say one of the great things about integrated youth services is that the sector's been very thoughtful about how to do this, facilitate collaboration, and then through everything that's kind of all the tools, all the aspects, it's built in to encourage collaboration. So, you know, first of all, allowing, you know, the backbone organization the time and the communities the time to come together, using a call for proposals. And so actually, like, one of the things is that communities aren't funded unless they can demonstrate that they can come together and they have the support of youth and families and so forth. And it's not something that the money just flows out automatically. Joe mentioned collaborative governance. There's also sharing of financial resources. There's common values and common brand that helps to bring people together. There's also, like as you heard from Dr. G, there's a spirit that this isn't done in the context of being forced to, you know, come together through spending cuts. It's we can serve youth better, and so let's come together for something that's positive, and it's probably the reason why, you know, the people got into the business of helping, you know, other people, and you know, so there's a whole bunch of things that are built into all the aspects of integrated youth services to make sure that we have the collaboration and that it's sustainable.
Great. Last one for this round, Dr. G.
I think this is a really important question that was asked. I think we've heard some really, you know, I think from the diversity of answers that we've heard so far, it's actually a complex question that is extremely relevant. And I think the fact that you've got so many different perspectives speaks to the fact that you need so many different representatives around the table. You do have to drop your own agenda, and that's hard to do because you are funded individually, and your success is sometimes dependent on how much you're doing at your own place, which inadvertently competes with other places, which means you do have duplication of services, and we have seen it. We are still navigating this. We see it in the healthcare system, and we see it even in our resources. And we have to go back to the data. We have to listen to the research that's been done. You have to talk to the people who are on the ground, who are understanding of what those barriers are. You have to have those people at the table too. You have to hear the population, the groups of people you're trying to serve. Their voices need to be present and diverse. And then we have to go back and see where, and be honest with ourselves and see where are the powers that be and who's influencing what, and be honest with ourselves. And I'm not going to be lofty here. Those are difficult powers sometimes to navigate, and we are aware of that. But I think it's very interesting what was said about incentivizing and de-incentivizing. We need to promote and reward collaboration between organizations and between organizations and the healthcare system. Because, and I think, interestingly, integrated youth services provides that gateway because it is on principle and by philosophy involving multiple voices and expertise. So we need to stop competing.
Thank you. So, Nevi and the questioners in the room have been waiting patiently. You can introduce yourself and then make your comment, ask your question briefly.
My name is Fraser Pickett. I've been taking notes as you're speaking. One, excellent presentations, super. I've been taking notes on some of the words that have been chosen. Food insecurity, housing insecurity, let's invest in services, mental problems, health problems, build it and they will come, common goals, and reduction in funding and so on. In Canada today, as you may know, there is and has gone through the Parliament, Bill C-22, which is called the Canada Disability Benefit, and is presently before the Senate. I'm looking at a common problem from the point of view of one of the common problems, and that's financial insecurity of our youth. There's definitely the Canada Disability Benefit that's coming. You have also now aging in place benefit that's being talked about. But I haven't heard anything about a Canada Youth Benefit. Because you have such a serious problem, and it is a serious problem, in the financial insecurity of our youth, which leads to all the other topics that I've touched on, which is the housing, is the food, the mental health. Have you taken an opportunity to look at one, and I'll go back to data and I'll finalize my question. Go back to the data that happened during COVID. Did you see, because there was a $2,000 benefit coming to certain folks, did you see a reduction in the call for services? If not, I'm hoping that the answer is yes. But have you thought about, from a national perspective, promoting a Canada Youth Benefit?
Thanks, Fraser. Nevi, you can get the mic to the next questioner. And you all don't need to answer this, but if you want to weigh in, let me know. And Jen has her hand up.
Sure, really appreciate this question because I think one of the things that we talk about a lot at Choices for Youth is it's about direct, immediate services, and it's about driving forward systems change. And I think what you're talking about is the systems change element. And so we've been a part of a coalition now for over 2 years advocating for a guaranteed basic income in Newfoundland and Labrador. And we see this type of policy change as being really critical in how we take care of youth and young families in this province. So we're really happy to see a basic income program that was implemented for youth accessing government services by Minister Abbott and the Department of Children, Seniors and Social Development in the fall. We're really pleased to see investment in an employment stability pilot project that's being run through the Education, Employment and Social Enterprise at Choices for Youth in partnership with Stella's Circle and with the Government of Newfoundland and Labrador. And we are really pleased to see investment in an all-party committee on basic income who will be putting forward a recommendation coming out of that all-party committee in the coming months. So those are some really tangible things, and I have to say kudos specifically to Minister Abbott's Department of CSSD that's really driving forward this innovation at the provincial government level. We want to continue to see that kind of investment because while we can provide all types of early intervention prevention services, it simply is not enough in meeting the immediate needs of young people, and ultimately it is an income problem, and we want to have better income supports for young people across our province, and basic income from our standpoint, along with a coalition of community agencies across this province, is part of that solution.
Thanks, Jen. Others on the panel have a quick response to this one?
Very quickly, and thank you, Jen, for leading up, because you just touched on 90% of the points that I was going to make. And speaking to that yes, we know in order to meet the needs of folks, we have to have a basic income in order to meet those needs. And that's, one of the things that we advocate for. Coming from the Indigenous perspective, tying into that, we've long said in our Indigenous communities as well that we know that throwing money at a problem doesn't work. And it's great to have supports and benefits. We're hearing about a food security supplement that the federal government is offering, and I believe that's $250 for an individual. So great, that's going to supply 1 week of food, was what somebody said to me, but what about the other 51 weeks in the year? So speaking to that, I think the guaranteed basic income is where we reach at it, and those supportive programmings, and then also allowing communities and youth as part of those communities to share their voices and to acknowledge the expertise in their own solutions. We have our solutions if we're just going to be listened to. Youth have their solutions and ways to move forward in a good way as long as they're supported by folks.
Any other different?
The only thing I want to add is that there's an assumption that people can file their own taxes, and that when you receive some of these benefits, they can compromise other benefits. Mm-hmm. So there's always a consequence.
Mm-hmm.
All good? Get at this point in a session like down the regatta where you say, all gone, all gone. Where are you, Nevi? There you go. Next one in the room.
Hi, everyone. I'm Bernice Hancock, and I work as the Executive Director of the Community Education Network for Southwestern Newfoundland, and very happy to be there. And I just wanted to acknowledge all the work that Choices for Youth, Sheldon, and the team have done in terms of the integrated youth services. But also in terms of just addressing the question that was asked, and we were just having a discussion here at our table, I think it is very important to acknowledge the work that has been done and the existing programs, but also the collaboration and the partnerships. Much like Choices for Youth, the Community Education Network has been in existence since the early 90s, and we too went through a lot of those growing pains and became actually Community Education Network and Associates. Community Youth Network and the Community Action Committee Family Resource Program came together. We have shared financial management, we have shared program management, and do all the streamlining things that need to be done at that level, and offer programs that range from youth engagement. So our mission is really to provide lifelong learning opportunities and also support throughout the lifespan. Because we are in a smaller community, so we provide those services right from prenatal, right from for seniors, for example, a seniors kitchen party, or community cafes that Tiana spoke about. Also career and employment service, adult basic education, housing support services. We're beginning supportive housing for youth, and again, have shared and met with the team there at Lily Place and been able to share some of their knowledge. And also, of course, our early years programs, and those include Healthy Baby Club. So we've, I guess in saying that, just acknowledge right across Newfoundland and Labrador that a lot of this work has been done. And, I've been at this work since the mid-'80s, so now I'm really aging myself. But so a lot of this has been done, and in a lot of rural and remote areas, we work this way. So we're learning from each other and we're collaborating. And and even sometimes when we're talking about integrated youth services, let's not duplicate what already exists in the areas, because there is a little bit of, right, when we're doing this and putting a call for proposals and have very good intentions of getting people to work together, that happens naturally. And for us, it's been over 30 years that community education has built this similar to Choices for Youth, and there's a lot of other organizations throughout the province. So just a little, just to think about how we're going to ensure that it's collaboration and that it comes from the grassroots, all your expertise, everybody here, the Choices for Youth team, but also there's just as much coming from the other places as well. So just to ensure that we're not duplicating in that process as well. So just wanted to kind of, maybe it's a question, maybe other people can comment on that, but just to kind of put it forward. I'm speaking for my organization and my area that I've lived in for many years, but I think that exists throughout Newfoundland and Labrador as well. There's a lot of work that has been done and a lot of ongoing collaboration. And you can sometimes inadvertently maybe affect that in a negative way, right?
Thank you. Anybody have a quick response to that one? And we're going to go back online after this, so be ready.
Yeah, that's a very fair point, and that's something that we heard loud and clear, not only with the steering committees, but when we're engaging community across the province. You hit the nail on the head. The expertise and the whole vision is the expertise is in community, and the wonderful work that's happening, whether that's in a rural setting or an urban setting. Those are where all the expertise are. And we have to listen to the voices of the community agencies. We have to listen to the voices of people with lived experience in order to make all of this work. So very, very fair points. There's tremendous work happening across our province. Now it's time to continue that work and to work together to move this forward. So Bernice, thank you.
Anyone else feel a burning need to jump in on that with something different? Good. Chris, I renamed you Matt earlier, but we're going to let you stay, Chris. Do you have anything online to add? Nope, good. Nevi.
Hi, my name is Karen Gray, and I'm the Director of Advocacy and Investigations with the Office of the Child and Youth Advocate. Been there for about 14 years, and we've heard many, many stories of poor outcomes for young people. This is not a question, it's just an observation, a comment, and maybe a challenge in some ways. What I hear, I'm hearing all wonderful things with respect to integrated youth services, something that we've been looking for and pushing for and really talking about when we make recommendations to government with respect to improved services. When I hear about all of these wonderful programs and impacts, I'm hearing for the majority of the age group that you're talking about, I'm hearing the right to be involved in decision making. I'm hearing the right to services, including, you know, appropriate mental health services and medical services, the right to be heard. I'm hearing the right to culturally appropriate plans, the right to identity. I'm hearing the right to the best interest in when it comes to policies and policy changes. I'm also hearing that young people deserve these services. Young people have a right to these services, and I challenge you guys to start speaking about the rights of children and youth. Include it as a language, include it in your discourse. Help us in our fight for children and rights youths by making it part of the discourse, and that's the challenge. Thank you, thank you, thank you for being part of the services, being part of the discussion. But I really would like to hear more about the rights of young people to these services and to this practice. Because it's only when we talk about rights is that when it gets on the, we talk about it as being, you know, something we have to do, not because they deserve it, but because they have a right to it.
Thank you. We have 5 minutes left. Nevi, anyone else on your... Okay, we're going to make you run out towards the window there. No, take your time. We don't want any injuries here.
I'm not used to speaking with a microphone. I'm usually loud enough. All right. Hi, I'm Danielle Lavers. I'm from Labrador West, but I think I might be the only one here from Labrador West. I'm from Labrador West. Woo! Are you? Yay! Another Labradorian. So this is more of a comment, not a question, but I want to go back to what Bernice said in that, you know, I've been in Labrador for 15 years. I hope that means I can call myself a Labradorian because I do. But I've worked in other parts of the province. But I will say in Labrador West, something that we do really well is collaboration. And that was one of the first questions that was brought up. And, you know, one of the things I realized when I first went there in 2008 was there was a need. This is what was happening. We were getting it. Everybody was at the table. I'll start off with that because I find that such a very positive place to be a part of and work in. So I find, like, obviously you have your agendas, it's usually a bias, but I find we usually come together for the common goal and the need. I also want to bring up choices for youth and integrated youth services, and that I love the fact that you include people with lived experience. Often I come from a healthcare background, and oftentimes you've had people in healthcare come stand up and tell you what you're supposed to do. This is what you're supposed to do. This is your health outcome. I hope I can't be accused of that, because I'm hoping that I gained just as much facilitating from the audience as what they did with me. Here is my comment. Being from Labrador West, a lot of people say, lots of money in Labrador West. Lots of money, you're in a mining town. And there is lots of money in Labrador West. But I think what people need to realize is that the poverty, there's such a huge gap in poverty. So we have really high, very low, if any, rental availability. And if you can't afford rental availability, it's not happening for people who are on low income, people who are low income. I don't even know at my income if I could afford to rent a place, and I'm not considered low income. So that's one comment. The other thing, I'm trying to get my thoughts together now. So yeah, but just to circle back, I think that we need to keep in mind, you know, that poverty looks different everywhere. You know, poverty in Labrador West, it definitely happens. It probably doesn't look the same in other rural areas just because of the money that's in that community, but I definitely think we shouldn't lose fact that there are people in need in these areas that tend to have affluence.
Thank you. And maybe a good point for, yes, and we'll give one last, right in the middle at the back there, striped sweater.
Thank you. First of all, I want to say thank you for all of your work that you're doing. It's important work, and I know it's hard work. I work in the public education system. I'm a school psychologist. I haven't heard a lot of discussion about our schools and how we're connecting to our schools. And I hope that if anything became really clear over the course of the pandemic, it's that schools are a catch-all for services for youth. We work really hard there's a lot of invisible work that's done, a lot of unpaid, unrecognized work that's done to meet student needs. A lot of the discourse was, when are schools reopening? Because kids aren't getting fed, they're unsafe, they're not socialized. So I would just, I guess, implore you I've worked most of my career in rural schools, and I'm glad, is it Travis? That you spoke to the transportation issue, because as a rural school psych, that was probably the most common barrier that I encountered, and I've driven students myself to their psychiatry appointments because there was nothing else available. So I would implore you to connect with the schools because there are, I hear a lot of talk of when they come to us, and that's half the battle. So I would just, ask you what's happening in terms of connecting with the schools, and just implore you to continue some work in that area.
Got a quick answer on what's happening.
Okay, thank you so much for that. And so just to speak quickly to it, we do have on our steering committees folks that are from the Department of Education who are working in schools, who are youth outreach workers who are located in schools or in conjunction with schools and community. And that's one of the things, looking at a larger scale, some of the advocacy pieces. So for schools in rural communities, they've become the community centers. That's where folks gather a lot of times. And so I'm happy to see, at least in my region, in Labrador as well as the West Coast, that community is being brought back into school as well, because we do know that teachers are, doing so many more things than just teaching children. And we do know that administration are doing so many more things than just, supporting the administrative needs of schools. So by working together, by bringing in mental health outreach workers into schools, while bringing in project coordinators from the Newfoundland Aboriginal Women's Network and knowledge keepers supporting youth for some of the land-based and cultural needs that they can get met academically in that regards, by supporting other needs that kids are identifying in schools, IYS is the way to go, because we need to reach kids where they're at. And whether that's inside of school or outside of school, this is an opportunity for our province, our communities, our peoples to come together to support youth wherever they are.
Thanks. I think Jan had a quick one, but Dr. G also.
Yeah, just really quickly, I also, because I think this is a fabulous question, right? And we think about where is the kind of point of least resistance in terms of connecting with young people and their families. The school system is a brilliant place to start. And so one of the initiatives that Choices for Youth has championed over the past several years is Upstream NL. This is an initiative that is focused on reducing early school leaving and decreasing rates of homelessness. It's based on early intervention and prevention. It's working directly within the school system. So Upstream NL right now is working within 2 junior high school systems and kind of a additional programming in now a high school. And that program is really exceptional and generating really great early results around providing stability for not only the young person, but the entire family unit. And that can look like anything from supporting with housing stability, but it can also be helping a parent find a job, right? So it's everything. It is that continuum and it's that wraparound support model, but it's looking at it a little bit differently, baked within the school system and supporting the family. So I want to highlight that, and there's others in this room. Dave Banfield, I know, is here, who can speak more to that model if you're interested.
But not right now. Dr. G.
I just wanted to echo my involvement in Upstream and ML has been like extremely positive. I've worked with families and over a couple of different settings, but our availability as healthcare providers to be able to serve the youth in that like sort of 12 to 15 age group that we don't usually see because of our outreach is really 15 and to 29 or 30. It's been really, really amazing, but also really eye-opening for me because I don't think that as a family doctor I was ever trained on how to really appropriately bridge that gap with the social workers, the counselors at schools who, like, I know intimately are really do sort of the work of magicians. And I think your question speaks more highly to the silos that we have institutionally that often compete with each other by accident, but really if they were so much more aligned, we would have such better, faster results. Because like you said, what happens in the school oftentimes is just like a whole other understanding, and it's really hard to have that message come out. So at least as a family doctor working with Upstream, it's been really, really positive to see how that happens. And then it's taught me to phone the social workers for my patients outside of Upstream. So thanks very much for your question.
All good. Clearly, lots of issues, lots of solutions, people bursting with opportunities here. It's been a great session. Thanks to the panelists for a great job. Thanks to the audience online and in the room. Thanks to Choices for Youth for inviting us all to be part of this. And I'll pass things back to Matt. And pleasure for the Harris Center to partner with Choices for Youth once again. And thanks for having us. Over to you.
Thank you, Rob. Thank you, panelists. Thank you, everybody that's in the room today. I, too, would like to acknowledge the Harris Center Memorial University, this beautiful space that we're in today. This is absolutely gorgeous. Thank you so much for hosting this incredible discussion that we're having. I'm 51 years old, and I'm proud to say that. And I'm old enough that I feel like I could say back in my day. So back in my day, I used to run, and I'm proud of this, have completed 10 Cape to Cabot races in a row from Cape Spear up to Single Hill. And you get up on top of Single Hill and you touch Cabot Tower, and your arms go up and you feel like Rocky. What's happening? Sorry, oh my God. You feel like Rocky Balboa, like that. It's such a success. That's how I feel today here. This has been an incredible success because of everybody that's in the room, because of the knowledge, not only with the speakers, but the knowledge that's out here today. And I really feel strongly that we're at a point where we are working together to benefit youth, as Sheldon said at the beginning. So if someone comes in that door with whatever conversation that they're having, we're there to help that person. Matthew, can you come up and help me with something? I see you're a staff and you're close to me and you're dressed really nice. Someone left their phone in the washroom. I'm going to look at your pictures. That's breach of. I don't even know your password. I'm sorry. You can pick it up afterwards. I want to thank people who really put a lot of effort in getting us here today. I asked Matthew to come up because I have some wonderful thank yous. Matthew, do you mind passing these out? Thank you, Dr. G. We'll deliver the parcel to you for your expertise and your wonderful work with Choices for Youth. Thank you, Ian. It's great seeing you here in the province. We never got a chance to screech him in this time, but next time for sure that's going to happen. I'll give you a fair warning. Thank you, Tiana, for your expertise. And really, I love how she brings in the Indigenous lens into every single conversation we do. It's needed. And I will say sometimes I forget it. And I think we all do. So thank you so much for that expertise. Thank you, Jen. She's done so much work prior to me taking on the portfolio and supporting the work that we're doing. She is a genius when it comes to this work. Thank you so much. Thank you, Travis. The first time I got to meet Travis was last night in person, but we've been on many a Zoom call. He is doing incredible work in the Clarenville area and leading so many things that are happening across our province. And finally, thank you to our to our research guru that we're working so closely with regards to the CIHR, funding to move and to really look at the work that we're doing. Are we doing a good job? How can we improve? And how can we move this forward? So that's incredible. I do have 2 or 3 left. I wanted to thank Sheldon, who's way back here. I don't know if you want to come up and get your... I mean, when he talks and he's got that passion and that love in his words, that just draws me in incredibly. I think that's what we need in a leader, and thank you for leading us in an incredible direction. So thank you from the bottom of my heart. I don't see Jo. Jo was here a moment ago. I don't know where she's gone. But thank you, Jo, for coming down and being part of the keynote and bringing an expertise to an incredible work that she's doing, not only in her home province, but right across Canada, and I would say across the world. So thank her so much wherever she's gone. They. Sorry. And if Joe's not here, I'm just going to take it for myself. So that's wonderful. And to the Harris Center. I don't know who would like, if Rob wants to come up, and please come up for being such a great part of the work and partnering in this incredible day that we have here. I don't know who the other 2 are for. I'm totally forgetting. Am I forgetting somebody? Joe. Yeah, oh, Joe was one of those there. I think one was for me, but I don't really want it. I don't want it, so we'll give it to someone else.
Matt Piercy.
Yeah, thank you.
Congratulations. Thank you so much for all your work on this.
Yeah, well, I will accept with gratitude, but I'm going to give it to someone else when I get a chance. I'll figure out a nice way to do that. Thank you all. We are having a delicious meal. Is it in here or we go out there? We are going to go through these doors now. Now. We have a delicious meal. Please stay and enjoy conversation. Come up and ask questions, whoever you want, and go Leafs go. You are awesome. Honest God, I could listen to you all day and